Hello everyone, hopefully you can hear me. It's that time already, 7 o'clock. I don't know where the day goes. I've got that, been trying to play with this camera because I seem to have this glow constantly on my face. Not quite sure what that is. Maybe it's something angelic, I don't know. Anyway, welcome to Designing a First Aid Kit. Oh my gosh, what a huge number of you that have signed up for this. Over 600 people obviously want to know a bit more about what to put in their first aid kits, which is really nice to know because it sort of helps me to realise that people really are thinking ahead. The purpose of tonight is not so that you go out and spend hundreds of pounds on items. I don't want you to do that. I have put quite a disgusting plug for my first aid kits at the front, which is a picture of the ones that I do. And that's not what this is about tonight. I don't want you to think I am selling you the products that I sell within my shop. It's to get you to understand the products that are worthwhile, and to use this as a resource because you might want to build something up over a period of time and not have everything all at once. And also you might listen to tonight and think, actually, you know what, there's a lot of things that I won't need. Now, I've just realized that the Q&A box is not enabled. I don't think. I think it should be now. Hopefully you can all see the Q&A box. What I'll do is, anybody that's done a webinar with me before knows that what I tend to do is run through a section of the course and then stop, look at the Q&A in case there's any questions in there that need answering, and then do the second section and then end with questions as well. I say, oh yes, I can see if someone's, oh, you've written in it. That's very, very helpful. Thank you very much. Thank you. So yes, so basically we're going to run through a lot of different products, a lot of different items. I'm not endorsing anything directly. I'm giving you examples of what I think are useful. And some things are just in your kitchen cupboard and you don't need to go out and even, purchase them necessarily. So let's start off with the first slide. What should your first aid kit include? Well, isn't that the burning question? And probably what we need at the time, we just don't have. It's like when you go to cook a meal and realize you don't have half the ingredients. It should cover common problems that you think that you will face. So for example, you're going on a beach walk, your dog is inquisitive, that they may come across something like a dead jellyfish. Well, in that case, shove a squeezy lemon juice bottle in your pocket because anything that gets stung by a jellyfish will feel much better with lemon juice on it. And that will help the tentacles to slide off as well. So you've solved a potential problem. So that's how I kind of look at first aid kits. It might be that you have a whole box of items, but take what you need with you at the time because you don't need everything all of the time. You can't wheelie around a suitcase. It'd look quite crazy and it would be quite hard on the sand as well. So carry useful items, but have a variety of other items that you have got potential access to. So because you are at the beach, because this has happened, you've got the instant sort of help. And yes, the old wives' tale of weeing on a jellyfish sting or a jellyfish to try and help the situation is slightly misleading. When we have a jellyfish sting, absolutely something acidic like lemon juice or vinegar will help. Urine isn't always acidic. Not if you've been out having a few too many the night before, you're likely to have very alkaline urine. Not only that, you are going to look kind of crazy urinating on your dog on a beach. The dog will probably move and you'll probably get arrested. So that won't help anyone. So what I would say is jellyfish stings need something warm on them as well, a warm compress. And this is where the urine thing came from, because obviously urine is warm. So you've got your lemon juice to help with the pain. In this particular scenario, we always say a warm compress. If you don't want to take one of these things, an instant hot pack in your pocket, you can't even see that actually. See if I can move, there we go. So this is one brand, there's loads out there, and you literally squeeze them and off they go. And they're ready straight away to use. So that's a very useful item to have, but you might not want to have the weight of that in your pocket. But what I would say is have it in your car. So when you get back to the car, you can use something else. So that's the kind of mindset that I go with a first aid kit. And obviously there's many scenarios. Definitely when you're dealing with any first aid situation, as I've put there, keep the Veterinary Surgeons Act in mind. So when it comes to minor first aid, the animal has to be under your care. So if you are a dog walker and something happens to a dog, absolutely you can help them. But if it's a dog that's being walked by their owner, you are a pet professional, they ask you for advice, and I always whittle on about this, you have to be very careful with what you say. There's no problem with giving some helpful, useful tips, but always follow it up with, I'm not a vet, you should go and get them checked by a vet. Emergency contact numbers, very important. Just make sure, because often what happens is when you ring the veterinary clinic to say that you're on your way, if there is a problem, it gives us time to prepare our end. So we tend to start getting things out ready. And actually, I quite like doing that, because usually I find that if I get out the things that I think are going to be appropriate, I almost stop it from happening. So I get out the worst case scenario items, and then it turns up and the dog actually with this sore eye where the owner has said it looks like the eyeball is hanging out, actually really isn't. It's just conjunctivitis. So it's quite nice. I feel prepared, but also feel like I'm warding it away when you tell me these things. So always have that number of where you're going to go so that you are ready to let them know. And also it might better give you more advice over the phone with the current situation. And then also, it's quite nice to have things like advice sheets. Those of you that have taken courses with me or bought kits from me, probably seen the little handy key fobs that I produce that have tips on what to do in a first aid scenario. So things like temperature, pulse, respiration on them, how to perform CPR, the size of a key ring. And they're quite useful at the time to give you a focus if you're dealing with an emergency situation. Now, we'll start with, what would we have if we're doing a clinical exam? What items do we need? It's a really good idea to own a thermometer. And again, those of you that have been on courses with me will know that, it doesn't always have to go in their bum. We can use an ear thermometer. I'm just making sure I don't kick my plug, because last time I did that, I managed to wipe the whole Zoom event out in one hit, which was not a good move. So you can use an ear thermometer, a human-based ear thermometer, and that is perfectly acceptable for both dogs and cats. And rabbits. You can use that. Just bear in mind, it often reads ever so slightly colder than what the actual pet is. So give it sort of 0.3 to 0.5 degrees centigrade, a little bit on the cold side. So just bear that in mind. But that is quite a nice, easy thing for you to do at home. Digital thermometers, I usually use this particular Perfect Pet brand. You don't have to, you can use any. You know yourself what a digital thermometer looks like. I'm just taking it out of the box to say to you that the little silver tip, I'm very aware there's glow on the screen, but the little silver tip at the end, this is a clean one, by the way, otherwise I wouldn't be touching it. Not been in any pet's bottoms. This little silver tip at the end is the bit that really needs to be inside their bum. And this tip is the bit that needs to be touching the rectal wall. So into the rectum, angle to the side. This is the side of the rectal wall. Angle it to the side. There's resistance there now. You can see when I do that anyway, the thermometer bends. So it's not going to hurt them. We've got that bit of resistance. Now we can get our temperature. Okay, so always use a bit of Vaseline or KY jelly on it. Stopwatch, fob, something like that is quite useful, like one of these little kind of nursing fobs when you're doing things like pulse rates, respiration rates, to a certain extent, with things like, well, you probably won't. I was going to say something like with CPR, but if someone else is there, it's handy for them to time you to know how long you've been doing compressions for as well. So some sort of access to some kind of watch. And, sometimes you might think all I've got, and I do this, all I've got is a digital watch and it has no second hand on it at all, and a phone. And I can put my stopwatch on the phone and that's okay, but I don't always have that to hand. So sometimes it's quite handy just to sort of have a little cheap one of these fob watches somewhere that you can just get hold of that's ticking along so that you can actually see the seconds passing by. It's up to you if you own a stethoscope. It's not against the Veterinary Surgeons Act. You're not breaking any rules in doing this. It's entirely your choice if it's something that you want to have. If you've never listened to a pet's heart before, it will sound weird, especially in dogs who, if they're very relaxed, often take a breath and the heart tends to take a little rest during that time. So that might be something that might throw you. So you might go for the good old fashioned feeling the pulse, usually in the inner thigh. And again, the other thing is a pen torch. Not so much for the temperature, pulse, respiration necessarily, but I do find it quite useful if you're trying to kind of look for thorns or any sort of item that might be in between in the coat, or just have a general look down the ear, because obviously you can't put a scope down the ear, but you could just shine a sort of direct light like that. Is quite useful. And sometimes, I mean, I use pen torches mainly for checking pupils, making sure they're actually moving. You know, when the light goes on, do they get smaller? And then when I take the light away, do they get bigger? Obviously, I don't expect you to go in depth, but it's quite a useful item sometimes to have around, some sort of light. So looking at eyes first, this in a picture is cherry eye, and it's a non-painful condition. It's not to be ignored, because this is the third eyelid in the dog's eye, because dogs and cats have 3 eyelids per eye. And what that bulging part is the third eyelid is prolapse. So there's a gland in there, a gland that produces tears, and that little gland has popped itself out of where it should be sat. And it is deemed to be a non-painful thing. Obviously, the first thing that dog is going to want to do in a lot of cases is rub it. How weird would that be, having that bit of tissue in the corner of your eye? Even if there's no pain there, it will still be an irritant to many dogs. Although this is not technically, you know, a big emergency, although it will maybe look like that to you because it does look scary, it does need treating in the majority of cases. Otherwise, they end up with dry eye if we don't treat it. So in terms of eyes in general, they tend to feel better if they are lubricated. So I put a couple of things on there. I tend to go for, I haven't got them next to me, but saline pods. So ready-made saline that's pH balanced, not salt water, like homemade salt water. Please, I always go on about this, but if you are insistent that you use salt water on your dog, if you feel like for years it has been your savior, put it in your own eye first. Make sure that your own eye does not feel any kind of discomfort, or, you know, if you've got a small cut on your hand, put it on there and make sure it doesn't hurt. If you're really insisting that you think it's the best thing ever, I want you to do it yourself first. And if you think it's comfortable, then by all means, at that point, perhaps you could use it, but it's certainly not something I like to use. Again, for eyes, always go on about this, cold tea, and I tend to go for just your usual breakfast tea or chamomile tea. Make sure you have given it plenty of time to brew, 20 minutes, half an hour, let it cool down, then bathe the eye. And I really like that for eyes. It usually makes them feel quite comfortable. And if you don't have any tea in the house, don't resort to coffee. It's not going to have the same effect, but certainly cool boiled water. You know what? Sometimes they just need a bit of moisture in it. You know what it's like. You've got a scratch on the eye. Sometimes having liquid in it makes it feel more comfortable. I have put some lubricant drops there that are a specific item you would have to buy in. Remend make a dry eye lubricant drops, which are quite nicely moisturizing. I think, again, you've got to think about your dog. So I have 2 Chihuahuas who have very bulbous eyes, and usually at least once a week, one of them wakes up with an eye that's half shut. I tend to find that just cold black tea, bathing once or twice, and the eye is back to normal. But certainly I have used these before just as ease, really, that I can just, especially if I'm away or something, I haven't got the opportunity to make some tea, I just put those in, and that tends to be enough to kind of settle the eye down. But obviously eyes are important. So, you know, if we're worried about them, we're always going to get them checked. And it's not to say that this bathing is going to solve the problem. It's just going to help with the comfort whilst you potentially seek some help. Definitely need a buster collar for these guys. You cannot have them rub. What started off as maybe innocent conjunctivitis ends up in a massive corneal ulcer. And, you know, that goes from a simple treatment to potentially weeks of treatment, not to mention the pain for the dog. But they will rub it, and that's the problem, and you've got to stop them doing that. So your buster collar is going to be the only option. Obviously, you've got the blow-up ones as well, rather than the plastic ones. I think with eyes, you just have to have those awful cones, because they just seem to be able to get around the blow-up ones for their face if they can rub their face on something. And also put a harness there. So what I mean by that is, if you've got a dog with an eye injury, or a dog that is recovering from an eye injury, or a dog that gets recurrent eye problems, they must move from a collar to a harness. We cannot, when a dog pulls on a collar, we get an increase in intracranial pressure, so pressure within the head. And that in turn increases intraocular pressure, so pressure sort of behind the eye. So if we've got issues going on with eyes, we don't want that added pressure happening. You know, we want to take that off the eye in general. So they are pullers. they should really be on a harness anyway. But if they have chronic eye disease or even, you know, recurring eye disease, definitely get them on a harness. So as I said, bathing can soothe. If it's painful, do not bathe. They will tell you. You know, I saw a cat. I mean, cats, you know, they're a whole new ball game, cats. Cats are like, they come in with their eyes hanging out, you know, the next day, not always, obviously, but an example of like things can be so bad for a cat and literally the next day they can look like nothing happened. They are the world's most amazing healers. I don't know what they have in their system. I think, you know, we need to work it out and start giving it to people because they are incredible and they tend to get better from things really, really quickly. Sometimes, you know, putting things in their eyes can be tricky, but if there is a lot of resistance, especially if you know your dog and you know they usually don't worry too much about things like that, then I would say it's likely because the problem perhaps looks worse than what you are seeing. My spaniel, I've told this story to some of you before, had what looked like a completely normal eye, but was very upset, very angry, aggressive, pretty much, from going around this left side of his face. I knew when I went near the eye, it was the eye, and it did look, the pupil looked slightly different. So I was like, okay, I couldn't even touch his face, let alone his eyes. So trying to bathe it would have just been in vain. I would have had to have pinned him down, which was just would not have been appropriate, and it would have just been awful. And actually, it turns out he had a grass seed embedded in his eye. He went blind and he suffered retinal detachment. And so, of course, the pain associated with that would have been immense. And hence, you know, any form of bathing at that point, I mean, I don't know, a bit of liquid probably maybe may have made him feel slightly better, but it wasn't going to happen. Even 5 painkillers down the line, he was still angry. So, you know, you can get some really awful things. And the eye from the outside didn't even look that bad. Keep lighting low. You know yourself, if you've got a sore eye, bright lights can really aggravate that area. So I would just say go easy on that. Make sure, you know, that we're not sort of exposing them to really brightly lit areas. And we're trying to keep light low, perhaps during travel. We know as well that eyes themselves, if the, excuse me 1 second, I'm just going to switch the, I've got a little fire going in here. I was freezing. And I've just come to realise that it's always the same. It's like when I go to a village hall and everyone else is, well, this doesn't happen, thankfully, anymore, because I always check. But I remember in the past, people be there like wrapping up in about 20 coats, you know, and I'm nearly in a bikini at this point because I always get really hot when I'm teaching. Maybe too much enthusiasm. Anyway, so change to pupil size. So again, if we see pupils, so this is kind of going away. This is just kind of giving you a little added extra about eyes. If pupils look very large or very pinpoint, often I find that quite common with a toxin ingestion. And sometimes over the phone, I'll say to an owner, do you notice their eyes at all? You know, and if they're in a dull lit room and their eyes, the pupils are really black and it's almost all you can see, then a lot of the time that is toxin related. Again, it's not something you're going to manage at home, but it's going to give us more of an idea of perhaps what is going on and how potentially much the dog is or cat is affected. So I said buster collar, gotta have one of these. This is a very important part of your first aid kit. You know, having tea in the house is the very first thing we've said. That's, you know, most people can get access to that very quickly. And even, you know, the middle of the night from a local garage or something that's open. But a buster collar, you know, you really want to keep one of these. If you are a pet owner, just have one that actually does fit the dog or the cat. If you are a pet professional, you're going to have to own a couple of different sizes. The damage that dogs can do and cats can do to themselves on the way to a vet's, to wounds, to eyes is horrendous. You know, I hear it all the time. Gosh, it didn't look that bad when I put him in the back of the car. Well, you know, because dogs like to have a little nibble and a lick, and cats the same. And so, unfortunately, you know, what looked like maybe something fairly okay to start with becomes really quite bad. And also, you know, it's just useful sometimes because some dogs and cats will get quite agitated after they've been to the dog groomer, like they get a bit itchy, like we might do, you know, if we've been, some people go to hairdressers and their head feels itchy afterwards, or, you know, people that go and have waxing done, they feel a bit itchy afterwards. You know, all those things can be very normal. So trying to sort of stop them from being able to rub and lick and scratch for the first 24 hours after something like that's happened will stop them from causing trauma to their skin as well. I put ideal for brachy breeds or brachycephalic breeds because they are very hard to muzzle. They really are, and actually I don't like having much around their face because many of them, they have some limitations sometimes to how they exchange hot and cold air, and so if we close their mouth for a prolonged period, we can cause heat stroke really easily in those dogs as well, even in mild temperatures. So I find these easy because you can get a buster collar, slide it over the dog's head. It's a bit of protection between you and them. It's not necessarily going to be great if you've got a highly aggressive animal, but it will help. And I also find it slightly easier than trying to get near their face and apply a muzzle. Of course, like anything in life, the dog, the cat is going to be much more reactive if they've never worn one of these before. Doing things like trying to get your pet used to these kinds of things when they don't need them is always a good idea. Muzzle training, buster collar training, wearing a pet t-shirt in case they need to for post-surgery, something like that. Those are things that you can always work on with your pet. So, but the day that they do have to wear a buster collar, it doesn't feel, they're recovering from surgery perhaps, and now they've got a buster collar, or they've associated it with pain almost. So almost having it on at times when it's not such a big deal will help them to get used to it. And as I said, there is an inflatable option, which I'm sure many of you know, and a softer version as well that doesn't keep bashing into the doors and, grazing your own legs when they go past you. But, you've got to see what works for your pet, because some of them are very, very savvy and they can get right round some of those soft ones and start to get to the place they want to get to. So it's about knowing that pet really. But for a very quick, I need to get into the vets, they're going in the back of the dog walking van, get the collar on, don't run any risks of it getting worse. So I always bang on a bit. So another free thing. So far you're paying about £5 on a buster collar. You don't need, things can be quite cheap with first aid items. There's some specifics that cost a bit more, but it doesn't have to be, most of you probably get a package at some point with bubble wrap in it. Keep it, cut it into pieces. You can cut it into pieces that would sort of slot over like a boot on a dog's foot. I mean, me looking at this now, this is just me coming up with this idea at the time, just thinking, actually, not only am I thinking about the reason why I would use it, which is on here, but actually it's not a bad little cover. I know you can just put a poo bag over a dog's foot as well if they have injured it on a walk and you want to cover it. But if you had one of these, as long as you've got a bit of tape to stick to the top, then this could equally work as well. But the reason that my main purpose basically for bubble wrap is heat insulation. So we've got a dog, it's had a major trauma. We've got to keep heat in. As soon as that dog gets hit by a car, the cat gets hit. I mean, the number of cats I see that have been in road traffic accidents and their temperatures are so low. I had one 2 weeks ago that I treated, a little cat that had been hit by a car. It obviously managed to get its way home, and the owner had realized there was something wrong, brought it in, and it looked terrible. And the vet student that was with me, I think, was almost like, are you not going to put this cat to sleep? Like, I mean, it's almost hardly even sort of responsive. And I was like, oh, well, you haven't heated it up yet. And as soon as we started to warm the cat up, the color started to come back, his mentation started to come back. Obviously he had pain relief and he had fluids, but half the battle was the fact that his temperature was so cold, he was shutting down. And it was hard to tell, is that because you've got some major blood loss, or is it because you're just cold? So, working out for us that's my job. I've got to work out what is going on and obviously have various aids to do that, and was confident there is no blood loss. I think you're just very cold. And as soon as we started to get that body and obviously treat that shock, part of which was warming them up, he started to look better within a couple of hours, like a completely different cat. So what I always say is, in a trauma, your job really is to try and reduce the amount of heat being lost, because often during transportation, I mean, for 5 minutes from the vet, fine, you might not want to do this. But for transportation purposes, if you're going a fair distance, then really you've got to try and keep heat in. Otherwise, this dog's or cat's body temperature is going to go through the floor. So both bubble wrap and aluminium help to insulate. The bubble wrap traps the air, the warm air. against the dog, sort of always keeps the heat in, and silver foil is reflective and stops heat being lost as well. Now, I mentioned silver foil there because you can use either bubble wrap, socks, bubble wrap, bandage, whatever you want to put on those feet. But you could also have a roll of aluminium foil and just wrap the feet and legs. Okay, they'll both work to insulate. If you want to, you can do bubble wrap and silver foil. In fact, you can put your bubble wrap on and then wrap it with silver foil. You know, however creative you want to be with that. But I want one of those items on those dogs' feet and legs because they lose a lot of heat from their feet. And equally, something over the body. You could invest in a foil blanket by all means. And obviously, it's reusable in many cases, unless they've got really filthy and horrible. But in a lot of cases, you can fold it back up and reuse it. So, you know, for the sake of a couple of quid, it might make it more sense for you to do that. But equally, if you wanted to, you could just use a sheet of aluminium foil over the dog. Quite a large roll, probably for something like a Great Dane. But you could do that. And if you had a large piece of bubble wrap, again, just keep that large piece of bubble wrap, put it somewhere that you know it's there. And again, you could put that over the dog's body. And then I would cover with a towel on top of that. So that's really useful for sort of managing heat loss and trying to keep the dog or cat warm, especially after trauma. I just put this as an extra. It's just a little first aid tip, really, that I don't think I ever really sort of, you know, mention frequently enough, especially in classes. To be honest with you, I have about 5,000 things to mention, usually within a single first aid class. I walk away and think, oh, I needed another week. And then I might have actually managed to get through it all. So all I will say is when you're traveling a pet who has been severely injured or has collapsed even at home, if they are cold, then the idea is to keep the temperature of the car warm, but I wouldn't have the fan from the car, directly on the animal. And the reason for that is if we've got hot air blowing directly onto the animal and they have some sort of active bleeding, which could be internal, and you might not be able to see that, well, you won't be able to see that, obviously, and it will cause what we call vasodilation. And so when those vessels dilate, they come closer to the skin, they become relaxed, and so more blood loss occurs. So we want to keep the pet warm, that is important, but we perhaps don't want direct heat on them. When the animal is cold, we get, or an area is cold, we get vasoconstriction. So the blood vessels move further away from the skin, sort of bury themselves down deeper so you don't see them. You'll notice in hot weather, you see your veins on your hands, and then in cold weather, you tend not to. So the advantage of that, of course, is that we can apply something like a bandage to an area that's bleeding and use an ice pack on top. And that will help to slower external bleed. So it's just being aware of, you know, how hot and cold are very useful, but they can also be detrimental. So if we are worried about a form of internal bleeding, we do not want hot air from a car fan directly on the dog or the cat. So talking about hot and cold, definitely you need to have some way of getting a hot pack, a cold pack. And, you know, an instant cold pack is ideal. Again, it's a bit like the hot pack, but cold. Every time I do that, I still get this glow. Wow, this is me. And basically you can get them again, snap it, crack it, and it goes instantly cold. Obviously this one's a hot one. And so you've always got access to an ice pack. You know, you don't need a freezer. So that's really, really helpful to have that. And as I put there, one of the things that cold packs do is they reduce pain receptors. They are extremely good for acute pain. So if we've got a dog that's gone, oh, I've just ruptured my cruciate ligament, you know, my back leg's off the ground, I can't weight bear, you know, maybe let out a bit of a yelp, clearly don't want to put their leg on the ground, then one of the first aid things that we can do is ice that area. So some people will go ahead and put the ice pack directly on the skin. I think it depends how freezing cold it feels. I think these instant ice packs don't tend to get as freezing as perhaps if you go and get frozen peas out of your freezer. They tend to be a lot more icy and cold. But you need to make sure that it's comfortable against your skin. Could you put it against your skin for 10 minutes? And if the answer is yes, then it's appropriate for the dog. And I think if in doubt, just use a thin cloth. If you don't have a thin cloth, then you just hold it on for maybe shorter periods of time, a minute on, a minute off, just so the dog doesn't go, oh, it's so cold, it's actually hurting my skin. We know as well that cold packs reduce inflammatory cells, so immediately you're going to get inflammation around any acute injury. As soon as you get something, you know, a bite, a sting, you're going to get instant whoosh of inflammatory cells. You know, because that's just what happens. And so what we do is we reduce that. So we make it, and inflammation is painful. So not only are you helping pain receptors, you're reducing inflammatory cells, also decreasing pain. So that's where they're very, very useful, and they're so easy. I don't think we use enough hot and cold therapy in our dogs and our cats to alleviate discomfort, really. So I mainly use cold packs for acute pain, so sudden pain that they present with, you know, even if you've got a cat who's got a swollen foot that you suspect it's been in a fight. Even if you've got an appointment booked and you know you're going to the vet in an hour or so, you know, if they'll tolerate it, a cold pack will help that area feel better and will help them to manage for the bit of time that they're potentially waiting to get some assistance. I mentioned before, you can use it on top of a dressing to slow an external bleed because it causes vasoconstriction. You can also use a cold pack on the bridge of an animal's nose to help with epistaxis, which is a nosebleed. It's not called nose epistaxis. I was obviously going to write nosebleed and epistaxis and decided that I'd write nose epistaxis instead. But I meant to, I don't know what I read, but bridge of the nose, yeah, probably bridge of the nose. I was meant to write bridge of the nose hyphen epistaxis, which is what a nosebleed, fancy term for a nosebleed is. And for those animals, we tend to encourage them to have their heads a bit more forward rather than back. It's not very nice swallowing blood. And often when they have swallowed blood, they sometimes vomit. And that also doesn't look very nice. It looks a bit scary, especially if they've just eaten. As I said, it soothes a bee sting, soothes a wasp sting. It definitely is good to use in post-orthopedic surgery. And I think it all depends on, you know, how much time somebody's had on discharge of your pet to maybe talk to you about the use of hot and cold packs. But have it on your radar. You know, your dog has gone for surgery on its leg, your cat's gone for a fracture repair, you know, that question of, oh, icing the leg. Like, you know, I've got that on my kind of list of things to do to help when I rehabilitate them at home. And then usually someone will be like, oh yeah, great idea. And what we know is that the current situation with icing or heating an area of the body is that we don't tend to do it for longer than 10-minute periods, because it can have a bit more detrimental effects on the tissue if we were continually doing it for long periods of time. In the case of heat stroke, it doesn't matter if they need cold on them, they need cold on them. I don't care if that's for an hour. But if we're doing it for pain, we're doing it for rehabilitation, we tend to do 10-minute periods. We might then do that every couple of hours, and then especially after surgery, we can be icing it every hour for 10 minutes. And then we might start going every 2 hours, every 4 hours, you know, reducing it. And there are situations where sometimes you can alternate your hot pack and your cold pack. And one of those times that I find quite useful is in wound recovery. So it might be that your pet has got a nasty wound and, you know, they're on treatment for it, but it's quite open and, you know, it's not very nice. And so often what you can do is, you know, you do 10 minutes with a cold pack, 10 minutes with a hot pack, 10 minutes with a cold pack. You know, you can alternate between, and what you find is it kind of encourages blood flow to the area. So it kind of takes waste products away, brings in fresh products of, you know, nice fresh sort of blood. It helps with wound healing. So they're really, really useful for a variety of things. Obviously, using heat stroke cases, as I said, there's no time limit on those. We don't mind if it's more than 10 minutes. You know, it's the most important thing is the dog is cold. And of course, again, you know, using ice packs on dogs with heat stroke, just making sure that they're not too uncomfortable. And if the symptoms are mild, then it's pretty unnecessary that you'll need to use them. Cold water is fine. But if you've used cold water in a heat stroke pet and they're not doing well and they've got to go to the vets, then during travel, you need something cold. So I usually tend to say, put ice packs around, perhaps, you know, allow the dog or cat to be able to move away from them if they did want to, if they felt uncomfortable. And equally, something that I didn't put on here that's just come in my head is if you don't have a hot pack or a cold pack, you can make your own. And usually I'll use something like a glove, well, not a latex glove, normally a nitrile glove. And what you can do is you can fill it with the appropriate water. So I do it sometimes where I've maybe got to transport a patient. Maybe a patient is going off to a specialist and they're stable, but perhaps, you know, we worry because their temperature seems to be dropping, or, you know, they're not finding it easy to sort of keep warm, a very young animal, something like that. So what I then tend to do is fill up nitrile gloves with warm water, tie them well, so obviously, you know, they're not going to leak, and then place them around the animal. So that's another way, you know, that's free. I mean, you could, if you don't have an ice pack, you can make your own. I say you could have a glove, you can put some water in it, you could either freeze the glove, or you could put a handful of frozen peas to make it really cold, and then, you know, use it if you think I want multiple packs and I don't have them. Fill up gloves with water, handful of frozen peas in each, put them around the dog. So something like you could do for something with heat stroke or something like that. The seizures, again, those of you who've been on courses with me will know the classic problem with seizures is that we say they shake and bake. So they literally do overheat and become like a heat stroke dog. If the seizure is short-lived, it's unlikely that they are going to overheat. But of course, when we start getting into sort of 4 or 5 minutes and above, their temperature is going up. So using cool packs to keep them nice and comfortable. But also there's that little tip that I always teach that, you know, has pretty much hardly any evidence around it at all, apart from the fact that I read it somewhere where it was believed to be useful. And then I started getting my clients to try it on their epileptic dogs, and they were like, this is wonderful. And I tried it on a dog with seizures, including my own. And I was like, God, that's really cool. It works really well. And all it is that whole thing where you just take an ice pack again and you put it on the middle of the dog's back, so the middle of their spine, to hold it on firmly. I had a lovely lady on a course yesterday that really did answer it well. She said it just slows down nerve firing, sort of like neuron firing. So should then, like, using ice anywhere like that just basically slows it down, and then potentially slows down that fit if they're epileptic. If it's a toxin, we won't necessarily help at all, but if they're epileptic, it can be really useful. There's no evidence that works on cats. I'm yet to try it on a cat. I've not had the opportunity. Thankfully, you don't get many epileptic cats. If you do have an epileptic cat, I would say it's better trying it than not at all. It's not going to hurt, but that's another little thing you can do with your ice pack. And as I said, finally, just making sure it's comfortable. You know, if it's going to be held on for a period of time, is it comfortable on their skin? And then your hot pack, I tend to go for the instant warm packs. You can use a hot water bottle, cover the hot water bottle. We can't have it sort of like a naked hot water bottle like in this image, because, you know, that would just be mega hot. I find the rubber gets so hot for these. So I would just be, you know, cautious of that. And again, the good thing about these is that they reduce muscle spasm. So, I mean, you could argue and say, well, a dog that's recovering from an operation, they're going to have pain, so the ice pack, but they're likely to maybe get some spasming in the area where they're not maybe using the area as much as they used to. So again, it could be a reason for alternating between warm and cold packs. Again, as I said earlier on, that it helps with jellyfish stings and the pain that we might get with those. And you know, anyone that knows me knows I've got an absolute love for senior animals. They're just literally like my favorite. And actually, this is going completely off topic, but I just felt so happy today. I've got someone that lives very close to me that's both her pets have died recently, and she said, I'm so lonely, I barely even feel like I can carry on, but no one will let me take on a pet. You know, she is very old, but the it was so sweet. It was almost like I get wind of this, and then I get told today about an elderly cat that's looking for someone's lap that it can just spend the rest of its life on. I'm just about to unite the two of them together. It was just that dream thing. Like, I'm being told about this cat, and this lady's telling me about this. I'm like, oh my gosh, you two, gotta get you two together. That was completely off the topic, but I'm hoping, I can't wait to see them together. It sounds like they're both growing old together, and they've both got, you know, we get a bit of arthritic pain, and they can, you know, I can help her manage that, which will also be great. Sort of looking forward to helping her introduce the cat into her life. It'll be lovely for her. But in terms of going back to our arthritic animals, they do say something really nice for them is to use a warm compress on especially painful areas first thing in the morning prior to when they move, if we can. Obviously, some are just desperate to go for a wee. But after they've been for that wee, can we offer a warm compress? So do we know the dog's got hip dysplasia? Can we therefore hold a warm compress on that area? Do we know that that cat suffers from arthritis? 90% of cats over the age of 12 do suffer with arthritic pain. So many of them would enjoy something warm on their body. So it's really nice to do that for them. And also I use cold and warm packs. In many scenarios, when I'm looking at joint disease, I'll encourage someone after a walk to come back and either use a warm pack or a cold pack on the joint that's affected or the spine or wherever they get problems after they've come back from a walk as well. So maybe pre-walk and post-walk. And usually I do find, though, that warm packs tend to be aimed at those with more chronic pain. So more of our arthritics, more of our dogs with, chronic joint disease, they're the ones that tend to appreciate the warm because they're the ones that are getting more of the spasming type pain rather than the one that's just injured its leg there and then. So moving on from hot and cold, we go to another important thing that you should have in your first aid kit. You can either have this stuff, Glucogel, which is not really coming up very well on the camera, but you get the idea. So that's the Glucogel. And I then put in my first aid kits, little pots of honey. And it doesn't matter, I'd say, if you've got a very heavy working dog, Glucogel might be a better option, just because it's a little bit more kind of intense. Like it seems to just be a bit kind of easier to, or quicker at getting the blood sugars up. But for the average pet, to be honest with you, honey or jam is very, very effective. So I put a few reasons why we might use honey or jam in a first aid kit. So yet again, this is costing you, for most of you, not anything at all. Or, next time you go to a hotel, you can take a honey pot. I hope no one owns a hotel and is like, great, that's all my profits out the window. And basically what we do is we smear it onto the dog's or cat's gums or onto their inside of their lip. It's very good for diabetic animals. A lot of diabetic animals, we tend to know when they are going low, they're having a hypo. They become very wobbly, disorientated, and some of them go on in seizure. They're very sleepy. They're always, again, going to need to visit the vet because it can be very serious. But to buy you time to make sure they don't go and have that horrendous seizure, using something like honey jam or Glucogel can buy you that bit of time. If a dog's eaten and a cat, although we don't see many xylitol ingestions in cats, but xylitol is toxic to both dogs and cats. So most of the time it's sugar-free chewing gum, some human toothpastes and mouthwashes. Those are the kinds of things that contain xylitol. And those are the things that if they're ingested can cause the body's blood sugar to drop dramatically. It doesn't happen to us, but it does to dogs and cats. And again, it might be that, hopefully you're aware because then you know to act. And if you are aware, even if you don't see any, abnormal symptoms, and usually symptoms start with as early as 30 minutes, what I will say is that many of them can go on and develop liver failure if left untreated. So even if you think, well, 24 hours has passed, he's fine, we'll really need to check that liver out because that's, the blood sugar is one thing. The liver is something we really don't want to allow to sort of suffer, so to speak. And the other thing as well that I find useful for these items is heat stroke, especially if it's moderate to severe and they are wobbly or potentially fitting. Most of the ones that I see that come in with heat stroke have low blood sugar. So again, for you, slap a bit of honey or jam on those gums inside that mouth, and you'll get a result that's far quicker than trying to feed an animal. I mean, an animal with heat stroke is not going to want to eat anyway. A diabetic animal, maybe, when their blood sugar is low, sometimes they feel sick. But it takes an hour for blood sugar to rise through eating, whereas it's instant when you're putting something on the gums like honey jam or Glucogel. And I just put on there as well, I guess it's not a first aid. Well, actually it is, I love a bit of preventative stuff. What can you have that helps your specific animal? So I've just put on there for working dogs. A lot of working dogs, like, a working spaniel that's maybe out on a shoot all day, they're burning calorie after calorie after calorie. I think I need to become a working dog. I've got so much weight to go. I'm like, oh, maybe I need to pretend I'm a spaniel and go out and start burning some calories. But anyway, the point is for these working dogs is that we often say as well that it's better to not overload their gut pre-working because we worry about too much food sometimes increasing the risk of a gastric torsion, a twisted gut. So we tend to say quite a long feeding gap for these if they're going to be working all day. The kind of current belief is 6 hours, like when you're going out and starting working at 8, that actually they're fed at like 2 a.m. It's a long old time of having to go without food, because then they say 6 hours the other end. So say you finish at 4 p.m, technically the dog can't eat till 10 p.m. It's now gone almost 24 hours or 20 hours with no food being ingested, yet it's burnt calorie after calorie after calorie. I mean, I think, as long as you're doing at least 2 hours either side, but they do say 6 for these very active animals. And in which case I would be carrying gels that are high in calories. Now, these gels, some of these are very useful for animals that perhaps have got trouble with eating and they're not taking in enough calories. They are a source of calories. It might be that the dog or the cat is recovering from illness and perhaps just not eating as much as they were, and we still want to get the calories in. Then these gels are quite useful. So just put a couple of brands on there, but as long as they're safe for pets, then you can use whatever brand you'd like to use. And then these are so hard, because I find these kinds of items very useful in a first aid kit. If an animal has been vomiting, had diarrhea, as long as it's not going on and on, especially vomiting, they can get dehydrated very fast. Diarrhea, if they're well in themselves and there's not a load of blood, we can tend to kind of manage them for, try managing them for a few days, as long as they stay well. With vomiting, if it's consistent, they tend to get very poorly very quick. And there's two main sort of rehydrating brands that offer electrolytes to the dog, which get lost when they have vomiting and diarrhea. But it's difficult because a lot of the oral aid brands, they do have chicken in them. And, we know in this day and age now, there's plenty of dog, not so many cats, but certainly more so dog, that have allergies to chicken. So that's important to check. The Oral Aid Active Dog comes in multiple flavors. So you can get hydration and electrolytes. They do a vegetable one. I think they do lamb, beef. There's a whole variety, so you don't have to go down the chicken road with those. But the gastrointestinal support that has prebiotics in it as well is chicken flavored. So, you need to decide whether that's a good choice for your dog. And again, the RF for cats, which I really like if they've got ongoing gastrointestinal issues. It might be they've got inflammatory bowel disease, it might even be something really nasty like intestinal lymphoma, chronic kidney disease. The bottom line is sometimes, hydration is incredibly important, and cats are notoriously bad for drinking. And so this can be very useful for animals that have those particular conditions. I put a question mark, supports heart health. That's what they claim they do. I don't know to the extent of how much that has been really looked into, but what I do know is that it does help. It does add in the electrolytes and it does hydrate the animal. And that's incredibly important when you're looking at some chronic diseases, especially in cats. And then rehydration support, they are literally sachets you can make up. I mean, Oral Aid's quite good because I believe you can freeze it for up to 3 years. So you could have a bottle and you could have it frozen in case you needed it, and then you can defrost it when you feel you need it. So it's got a long shelf life within that department. The rehydration support, for some, that might be easier. Say again, if you are out on a shoot with a dog, or you're doing a lot of agility or really full on day, you might find that easier because you can just mix it with water when you need it and then offer it to the dog to drink. And it can be used in cats as well. And obviously where it's sort of freeze dried, again, it's really got a decent shelf life on it, but it's really for use in early use in things like vomiting and diarrhea. And if the vomiting's not stopping, then it's to no avail. It won't hydrate them enough. Vomiting, they tend to lose so much fluid. And just a little mention for our rabbits and our guinea pigs as a first aid item: recovery food. It's super important when a rabbit stops eating. Usually we go for Emerade for guinea pigs, and rabbits and recovery as well. You've got both sort of options there. we usually say we've got to get syringe feeding. You know, we can't let the gut stop moving. It's very, very important. So gut stasis that happens in rabbits and in guinea pigs, it's not a symptom. Sorry, it's a symptom. It's not a diagnosis. So when we say that an animal has gut stasis, it's usually because of pain or something else that stopped the gut from moving, but certainly trying to keep the guts moving, especially if you feel like the rabbit hasn't eaten very much, it's 2 o'clock in the morning. If you've got recovery within your home, syringe feeding is a good place to start. If they're spitting it out and they don't want to take it, then, you know, we've got a problem here. And actually 99% of the time, rabbits and guinea pigs always need checking because they are so small and they can deteriorate. You know, if they go without food for 24 hours, they can be in a horrendous mess. But it's also good post-surgery. You know, you've just taken your rabbit in to be castrated. He comes home, he's got his pain medication on board. But, you know, like any animal after an anesthetic, they might decide, I don't want to eat. So syringe feeding is a really important part for their recovery. A little plug there, that if you are interested in rabbits, I have got a nice webinar called Healthy Bunnies webinar that covers everything about rabbits really in a nutshell, in quite a lot of detail. So if you do care for rabbits, then it might be a useful one for you. It's not very expensive. And you just say you might find it useful for you to use. Again, I've just put like there with recovery, we tend to try and do 5 feeds a day. And we're giving about 15 to 20 mils of recovery mixed up food per feed, or we're trying to do it more frequently than that. And we're trying to do it more in the daytime rather than the night. You've got to let them have some sleep as well. And then we've got another first aid item that I think is very useful. And you don't have to at all invest in a Europet. You can use a good old-fashioned ladle to catch your dog's wee. Just maybe you don't want to cook with it anymore. But you do need a sterile pot to put it in, or as sterile as you can get it. I've had people before using old jam jars and they haven't been cleaned properly. You always risk that you're going to get a trace of sugar in that urine, and then you're going to start thinking maybe the dog is diabetic or the cat's diabetic. So Europets, obviously, they are there. Again, they cost a few quid, and you can catch the urine another way and then just pour it into the pot if you want to. If you are going to use the collection device, probably best to wear a pair of gloves, because I've known many a time where they end up weeing on your hand. And remember, with urine, we only need a small amount as vets to be able to tell you a lot about the animal's urine. For cats, you're going to have to use non-absorbent litter. I think if you know your cat is notoriously prone to urine problems, or maybe has kidney disease, and you like their urine to be checked perhaps once or twice a year as part of managing their kidney disease, we usually do that alongside a blood test as well, then you've got a way of collecting the urine and to be able to take it in to be tested. Urine testing is super important for anyone with a diabetic animal. Again, I've just put another really gross plug for myself in there. Anyone that knows me, I'm really not a salesperson. So when I was putting this on, I was like, oh gosh, I'm actually mentioning all the things that I do, which I always get a little bit embarrassed. I never usually tend to do it in courses. I'm like, just don't tell people about all the other things that I do. But anyway, I do have a new course coming that's pretty intense for those people that either care for or own a diabetic animal. There is so much you can do, so much. It's almost like you get told you have a diabetic pet and then there's no other follow-up around that, only what you might read, and no one's guiding you perhaps with their care. And you know, and one thing about looking after a diabetic animal is that, you know, one of the first aid items I would say to anybody is you need to own some urinalysis sticks. You need to be able to dipstick your pet's urine, and it's not a bad idea to run that fairly frequently, because if there is a problem brewing, we will see glucose and ketones in the urine, and they shouldn't be there. And equally, animals with diabetes are very prone to urinary tract infections, and so we might see blood. We might not see it in the urine, but we see it brewing on the dipstick. Even if it's a case that the animal's quite well controlled, I'd still say dipstick once a week. You know, you want to make sure that there is no blood present in that urine, because urine infections in diabetic animals can be a whole more serious event than a urine infection in a dog or a cat that doesn't have diabetes. They can get really quite poorly with it. So that's why I say that urine is something that's very important with a diabetic animal that you need to be monitoring at home. And I, again, you know, usually teach people in a consult, but I'll be teaching you obviously via a course. And then another thing, so I have these ones in my shop that's a sling or harness, and they roll up, so you can fold them up. They come in like a little bag that pulls together. You can put it on your dog walking belt or whatever you need to do. And so if you do get an animal collapse on a walk or really injure itself, this obviously goes under the belly. The straps go to the top. There's a little bit here that basically holds the straps together, so then you can just hold it with one hand and take the weight. Because, you know, if you have got a fairly large dog, and if you are a dog walker and you've got 3 others or whatever with you, you know, that could be a logistical nightmare. So having something that will aid that dog back to the car if they have injured themselves will make your life much easier as well. I mean, if you're at home, you know, you don't necessarily need to own something like that. You can just roll up a towel and put it underneath the pet's belly, as long as it's long enough and you can hold the ends, obviously either side around their belly like you would the harness. I think, again, it's worth investing, and there are some that are very posh and very expensive in terms of sort of pet slings. What you can do is, maybe if you feel like you've got a dog that maybe does go off the back legs or does need a bit of help, especially senior animals can have vestibular attacks. When they do that, they often can't walk properly for a few days. You know, they need to still get up, they still need to move, and sometimes, you know, taking some of their weight really helps them. You know, it's important that we think about that. I mean, dogs put sort of around 60% of their weight on their front legs. So the front legs are taking so much of the bulk anyway. And if the back legs then decide, I can't do much work, then it's so much pressure on those front legs. And if you've got an animal that's already arthritic in a front leg, that's horrible. So again, they're quite useful if you have got an elderly pet, if you think they might need some assistance sometimes when going out to the toilet. You know, if they perhaps have days where they're a bit stiff, you can take some of that weight for them. And then again, if I am lifting an animal from the ground that's been injured, this is more a towel now. I'll tend to lay down a coat or a towel. There used to be this thing, you know, in first aid where, and I mean, maybe it still is. I don't know, because I don't know. You know, other people teach. Lots of people teach first aid, and I know that there was always a thing. I think it probably maybe is still a thing, where you take the parcel shelf out of your car and use it as a stretcher for an injured animal, and they're going to wobble right off that. Use a towel, let them slump in the middle, let them sort of, you know, if they've got a spinal injury, then you're not going to be able to keep them completely flat anyway. So do not worry. You know, you can't. I can't. You know, we've got to move them somehow. They're not going to be like a human where we can lay completely still. And a parcel shelf, you know, often it can become like a wobble board. And if the animal decides it wants to try and get up, you've got no control. Whereas a towel, you can bring the corners in and keep them in that middle area. So I wouldn't use that kind of old train of thought. I mean, I used to think it was a great idea years ago, 10 years ago or something, when I first started teaching. And now I look at it and think, actually, it's a disaster waiting to happen if we were to recommend it. And I mentioned earlier as well about lemon juice for your beach runs, or, you know, not peeing on your dog. I just always wonder if anyone has actually ever done that. Please don't send me pictures if you did, but you can tell me your stories. So basically, as well, if you don't want to take out a big old squeezy lemon juice bottle, I think these are really cute. These little bite and sting relief packages. I get them direct actually from the lady that makes them. She's lovely, and they're really great. So they're just like wipes inside a pot. So it's like a pot of apple cider vinegar. I was looking to see if I have one in front of me. I don't. But I put these inside both my first aid kits, actually, the big one and the small one, because I think they're really useful. And there's a lot of sort of apple cider vinegar liquid, and then you've got a wipe inside, and when you push the middle bit up, it kind of impregnates the wipe with all this liquid, and then you can use it directly on the area where the dog or the cat has been stung, either by a wasp or a hornet. So there'll be the two that you would use this for. Not a bee, won't work for a bee, just a wasp or a hornet. And again, you can use it. Obviously, there's not copious amounts of liquid in this. So although it's small, it's handy for a jellyfish sting, you know, unless the tentacle is kind of automatically released itself, you could use it directly on the area then, but you won't have enough liquid to try and get tentacles off with it. And so for your B, don't forget your bicarbonate of soda. Again, I feel like I'm telling you quite what I think are quite, cheap items. There are lots of little helpful things that you can have without having to go and sort of stock up on a million different types of stuff. So bicarbonate of soda, I tend to make it into a thick, spreadable consistency. So you can't just sprinkle it on the area. It does need to be mixed with water. And as long as you feel like, it's not so thick that it's crumbly, but it's thick enough that, it's not just going to slide off. So sort of a nice paste sort of consistency. And I'll rub that all over an area where the dog has been stung by a bee. Ingestion of bicarbonate of soda is, actually, as I've put there, we started to look at adding bicarbonate of soda to animals' diets who have renal disease, kidney disease. You have got to ask your vet about that, because often we look at the blood results and see if sodium is low, and we tweak from there, and add in things as we need to. So ingestion wise, it's not dangerous, but certainly I wouldn't go willy-nilly adding it to your dog or cat's food if they have kidney disease without speaking to your vet first. But definitely you could speak to them about, could this be a good supplement? So we can use it for bees. We can use it for stinging nettles. So stinging nettles, straight in the bath if you've got the bath, or hose, if that's what you've got, or watering can, whatever it needs to be, and plain water to start with, because you're washing off the fine hairs that the stinging nettles leave behind. And then if they are in the bath, plug into the bath, bit of water at the bottom of the bath, few big spoonfuls of bicarbonate of soda so that you've got a solution made, and then you wash the legs with it and the feet, and that will help with that running up and down stairs, or oh, I can't get comfortable. So that's a really good use of bicarbonate of soda. And then of course in your first aid kit you've got to have a tick remover. No alcohol, no Vaseline, no burning them off. I see all of these things and I'm like, oh my gosh, guys, honestly, these cost like a couple of quid. Just have a tick remover. Like, we don't need to go and get a lighter and start trying to burn it off. And I mean, all that's going to end up in is a burn on the dog or the cat, So basically I like the fork tools. There are a few different varieties available. For me, this design I find is the most reliable. Obviously, if the tick is very tiny, although they come in different sizes and you can get small ones, I still find those incredibly hard to be able to remove with anything, really. And I wouldn't use tweezers, because with tweezers, what you're going to do is often you're going to lift the tick up. And what you need to be doing is twist, not pull. It's kind of your way of loosening it, basically. So you just need to twist. If you do get a case that the head is left in, I've had this with my own dogs, especially those tiny little ticks that they get. And I'm like, I just want to get it out. What I tend to find is, as long as you keep it clean every day, and we'll go over some products for cleaning in a bit anyway, you'll find that eventually it will form a scab, and tends to be that when that scab comes off, so does the head, comes out with it. It's not ideal, but it happens. And actually, as a vet, there's no other real way I can help you. There's no other way. I've tried before. Owners have brought in a dog where the head is left behind, and I've tried with sort of a fine needle to see, like a splinter, if I can release it. And in all honesty, it just makes them sore, and I can't get it out. And so I often say, your best point at this time is just to be hygienic with the area, clean it, and it will scab over. And then at that stage, that will usually bring out with it the head. I've only seen one in a cockapoo where they didn't even realize there was a head in there. So for all we know, it could have been buried quite deeply. It wasn't a removed tip by them, so I'm not quite sure. But anyway, it formed an abscess on the leg. It was fine. We as soon as I was like, oh gosh, it's a tick head. As soon as I pulled the scab off, I realized there was pus and there was a tick head. That's very unusual. So most of the time they'll just come away of their own accord. So I often find when you've removed a tick, if you want to use something soothing on the area, you can use something like arnica cream. I'll show you the brand in a second that I tend to go for. They leave a lump for a period of days. That's normal. They do carry Lyme disease, and they do carry Coxiella burnetii, but we don't see that really very often in the UK. It'd be more Lyme disease. It is in the UK, but it's incredibly unusual. I have never diagnosed a case of Lyme disease in a dog. or a cat. So the question is it rare or is it underdiagnosed? You know, it can be difficult to diagnose Lyme disease. A lot of people will say keep the tick and we test the tick, but that's shown to be quite unreliable. And so it's incredibly difficult actually. And sometimes, you know, you might not get symptoms develop for quite a long period of time. And by that point, you may have got rid of the tick. And actually, as I say, testing the tick is quite tricky, but it can be tested. It tends to cause kind of lameness and kind of waxing and waning signs, mainly in our dogs is what we see it in, you know. And sometimes is it that we've got Lyme disease going on, but we've actually thought that perhaps they just have generalized joint pain, you know, who knows? But I've never tested one for Lyme disease in my life. And then another product that's quite nice to keep, I've got some here. I always keep that for my dog, Fat Alan. Those of you know Fat Alan, he's been on a diet. It wasn't intentional. Obviously, I don't believe in fat dogs, but Alan likes to steal food. And unfortunately, because he's only a tiny chihuahua, he started to lose his waistline quite quickly. But his waistline's coming back now, actually. I think he's feeling very good for it. He definitely looks much better. I just kind of came home one day and went, oh my gosh, Alan, you're fat. Whereas my other two dogs are really slim. So poor little Alan, but he's starting to actually look quite, you know, getting his six-pack back. Anyway, so Epsom salt foot baths. I sometimes do this for Alan because Alan gets trouble with his feet, gets like athlete's foot. He gets sort of pododermatitis, so itching in between his toes. When the skin isn't really sore, I'll use an Epsom salt foot bath, and I find it just gets bits of dirt out. I like picking, actually, just like, what's that? Oh, looks like a little ingrowing hair. Or, you know, I find it really useful for that. If dogs are really at their feet, I find it really useful to kind of help to get bits out that they tend to try and lick and do themselves. And then it's hopefully stops that whole process of them biting their feet. I was looking at his feet the other day as well, thinking they look really good. I've been doing a lot with his feet because he does really struggle. And yeah, then at that point, when we've made that Epsom salt foot bath, so I've said 400 grams to 500 mils of water, or some people will say 1 cup of Epsom salts to 2 cups of warm water. We usually say dunk it for 5 minutes and put the foot in there. Give it a bit of a rinse afterwards. Yeah, we're looking for hairs and blackheads, and you can usually see them just sort of poke out towards you, because the idea of the Epsom salt foot bath is that it draws things out to you. Unfortunately, it's not effective in cats. And well, it's not that it's not effective. There's a question mark as to, you know, do we need to do it so much in cats? You know, because we do get situations where I suppose they do potentially get an abscess, but usually it's higher up on their body rather than on their feet. And, you know, there's that question mark of, can they be a bit sensitive to Epsom salt? So there's been very little. Those of you that are very cat orientated would know that most things always revolve around dog first, and then they tend to spread out to cat later. And it's sad really, because we have more cat owners in the UK than we do have dogs. But there's always, if I write a course about a cat, I'll maybe have 10 people. Do it about a dog, I'd have 400. You know, it's sad, but it's true. And so again, I'll usually do this, might do it 2 or 3 times weekly in a dog as a routine for caring for their feet. In terms of a grass seed, I'll be doing it for that grass seed. So it might be that you've got no other reason to do it, but you now suspect a grass seed. Dog's been like really, really going at an area. So use this. I then tend to massage the legs. So I go from the kind of elbow area and I just slowly massage down after it's been soaking in the Epsom salt. Sometimes when you take it out the Epsom salts, you see it poking out and you can pull it. But it's a great way of then often I'll go down, get between those toes, have a little push quite high up, and then you find it just pops out. It's great. So definitely first aid thing to do to try and draw it out, because, you know, if we can't, as a vet, if we can't get them out, they're going under anesthetic and having the paw cut open. And so I'd always say to an owner, oh, do this for me first. Let's see if this solves the problem, because obviously anesthetic's a big deal, and I'd like to not have to do that if that's possible. So that's a little one for you to use. And just as a sideline for that, again, it's a very focused dog, but Mush's Secret Wax, it's not really a first aid item in terms of, you know, you need to use it in an emergency or a minor first aid problem. It's more a preventative of trying to stop an injury from occurring in the first place. So Mush's really helps traction of the feet. You kind of almost sort of paint it on the paw pads. So it's very good for animals that are in cold weather that might slip and slide and injure themselves, and equally like warmer weather just to protect the pads. So I do like a bit of mission. So it's another thing that you could look at and hopefully prevent an injury, which means then you don't need to use some of the first aid tips or have a vet visit. Okay, I'm going to look at some of these questions. Ooh. Let's have a little look. Yes, first question was, can I share these slides with you? Yes, absolutely. And I forgot to say that at the beginning. Yes, I can. What I tend to do is I tend to send the recording of tonight. Oh my gosh, I had that moment of, oh, you are recording, aren't you? Are you recording? Oh my gosh, I hope you are recording. If you don't, if you're not, then it means I'm going to have to sit here and do it again. If I send the recording over, and I literally send over the slides, and then I'll send, it's almost like a generic certificate. So it's basically going to say on there that, you know, you've attended the webinar. So yes, I will. So I'm just like now paranoid I haven't recorded. If I haven't, I'll have to sit here and record it all over again. The other question, when you say eye bathing, what does that mean? Like pour it over the eye? That's a really good question, and I didn't explain that very well at all. So by that, I mean basically taking something like cotton wool, saturating it with cold tea or whatever it is you're using, and literally holding it, the eye, and squeezing in the liquid so that the dog or cat is blink, 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 blink. So not just wiping, but squeezing it in. That's a really, really, really good thing to be able to do, because then you'll get moisture into the eye. Tracy said she's now got a new use for the insulated bubble wrap that the bags of frozen dog food come in. See, recycling as well. I'm trying to think of the environment too. Is there a limit on how long to use a hot pack? Yes, 10 minutes, the same as the cold. Reference old dog, I use a small heat pad under the bed. I did this on my dog with Lafora. Oh, I remember, yeah, Sam, you were telling me about a dog. This was when it was chilly, and it was a human heat pad with variable settings and sleeve. And I think that's nice to offer that pad where they can come and go when they like, when they feel that I want to sit there, and more of a muscle relaxing. And those heat pads don't seem to be as intense as a hot pack. Yeah, I think that's a really good idea. Laura said, what do you think of animal-specific bone broth in comparison to something like Oralade? Yes, I think a bone broth is good. And I probably should put, the only thing you might not get so much with bone broth is it's good for hydration, possibly doesn't offer all the electrolytes that these kind of items have. But having said that, you know, hydration is part of the battle. So that it would be a good idea. For urine samples, would a puppy pad with the dog's wee on it be suitable for testing? Oh, it's hard. You know, sometimes I'll syringe urine off the, you know, the floor of the consulting room, because, you know, that's all I've got as an option. The dog's just urinated on the floor, the cat's urinated on the consulting room table. It's not ideal if we're going to send it to the lab. If we're literally doing a dipstick, then yeah, you know, we can't make blood up, we can't make protein up, we can't put ketones there that weren't there. So I think it's better than nothing. If it's literally all you can get, yes, I think it's better than nothing. I've done things like that before as well, and I've literally, the dog or the cat's urinated in its cat basket, and I'm there with a urine dipstick, you know, squeezing it onto the newspaper or something, you know, come on, give me some urine here. So yes, it's not my ideal, but I think it's a better than nothing. Tracy's put on here, she's used cotton bags for life as slings. Split down the long sides, keep the bottom intact, loop around the abdomen, and use the handles to hold. Good in an emergency. That's a very, cotton bags for life. Yeah, that's a very good idea. Especially if you've got sort of small to medium dogs, that would be really useful, because you often do need something to help them, especially if you're like, I can't lift them in, you know, to a car, I can't walk them back to a car, you know, you need something to help you. Oh my gosh, Tracy, Spaniel, 30 years ago was the second dog in the UK to have Lyme disease. It really is. I think it's probably possibly that we just don't diagnose it enough, perhaps, or perhaps other diseases come to a head because of the Lyme disease and we focus on that rather than the original thing. I don't know. It's something that now I've spoken about it on here, you know, anyone that knows me knows that, you know, next time I sit down in front of the computer, I'm going to go down a massive Lyme disease rabbit hole of, like, you know, all the stats and figures. And Oh, yes, you can. Can Mishra's wax be used inside as well? My older dog struggles with traction on the lino floor. Yes, you can. That's one of the things that I like for it as well. I think try it for traction because I do think it can really help with the kind of arthritic-y dogs. Obviously, as well with lino, if you find there's a particular area, you can roll a yoga mat out as well on a specific area just to help them get traction, but try it by all means. Oh, Karen said I'm recording. Tracy said I'm recording. Laura says I'm recording. Lynn says I'm recording. Rachel says I'm recording. Oh, I was like, it's one of those things, isn't it? Technology just drives me mad. Melina, just to check I understood, for xylitol ingestion, can the vet visit for the blood test wait until the next day, or does it need an emergency visit? Right, so xylitol. Xylitol lowers blood sugar. It's really weird. The animal sees it as real sugar and not pretend sugar. This is dogs, cats, horses, is a range. I think the only no, maybe rats can't either. I know rats are one of the only ones that can eat, I think, copious amounts of things like chocolate or something and not get intoxicated. I need to check that, but it could have been xylitol actually. But they have something that they're not reactive to. But most animals have a reaction to xylitol. Their body sees it as real sugar. Their insulin absolutely goes through the roof to try and so-called tackle this sugar in their body, but it's not real sugar. So the insulin, they release so much insulin and it's got nothing to do. So now they've got all this insulin floating around in their body. Now, at that stage, if you know it's been ingested, I would say they always need to go to the vet immediately, because if they've ingested enough, I mean, I think if you know the amount, there is an amount, and I can't think off the top of my head, but there is an amount that's kind of fairly safe. A small amount will be okay. But if it's a large amount, which for some animals can be as much as just 1 or 2 pieces of chewing gum, it hasn't got to seem like they're eating a lot, then it will start to have an effect on blood sugar. And that can happen sort of anywhere from sort of 30 minutes to several hours later. And of course, once that blood sugar is dropped, you've got an animal that then's having fits. So I'd usually say at the very minimum they go, and I tend to keep them with me for a while and keep just doing an odd spot check of their blood sugars and making sure that they aren't dramatically falling. If it's too late, they've ingested it, and you come home to an empty chewing gum packet on the floor and you think, well, I've been out the house for 3 hours, I still would go and get them checked, and I'd carry my honey or jam in the car in case they start going all a bit wobbly and having a fit. So it all depends. Not all of them will have this massive, like, low hypoglycemic reaction, and not all of them will develop liver failure, but I tend to check them initially within that first 24 hours for hypoglycemia, make sure the blood sugar is not low. And quite a lot of them I end up putting on fluids to support their body to prevent liver failure. So yes, check straight away. I could have just said that, couldn't I? I went in the long road round. Sorry. Yes, you absolutely, Julie, get slides, recording, and a certificate of attendance. Don't worry. Kirsten can't see anyone's questions. Is that normal? I don't know. I don't know. But I am reading them out as I go along. Michael's reassured me that I am recording. Thanks, Michael. Your first webinar you've ever done with me. I hope you're not like sat there dying of boredom. Ella, would you recommend cold packs post-surgery on stitches, i.e. after a lump removal or spaying? Yeah, I would. What I would say is that, you want to make sure it's not really anything wet, because you don't want to get the area wet. But yeah, I would. Anything that's inflammatory for that first few days post-surgery will really make it feel better. Just those 10-minute periods, or maybe at the beginning, just 1 or 2 minutes. If you think the pet's a bit like, oh, I don't know if I like that or not, and just trying it and seeing, and some of them will be like, yeah, that's amazing, and I think we need to be doing more of that. But half the time we're under so much time pressure in clinic, perhaps these tips don't get relayed to you. And we should be doing more things like that. So the answer is yes. Again, I went around the long road again. And what is the difference between non-alcoholic and alcoholic wipes? Are they both safe? And what would be the different uses? Yeah, I have both of those in my shop, and you can use both. So we use the alcohol pre-injection swabs, and we use the non-alcohol. To be honest with you, because it's minimal alcohol, you can use either, and either will be just as useful. So I know that, so really not as in one's alcohol based, the other one isn't, but both of them have the same idea, that they are there for cleansing. So you could use either. That's a good question, Kirsten. Can Mishra's wax be used on cats? I would have to double check, and I should have done that today. I don't believe they advertise it for cats, and that's something I'd have to go and look into, because as you know, cats can be rather funny about some of the things you use on them and reaction to things that seem like they shouldn't react. So in all honesty, that's something I'd have to check their data sheet of whether that, you know, it has been used on cats, unless anybody on here has ever used it on their cat and knows. More of the, I'm definitely recording, good. What's the biggest mistake dog owners make in an emergency that makes your job as a vet harder when you first get a dog in? Gosh, that's a really good question. I think for many owners, some of the problem is non-recognition. So it's an emergency, but they haven't recognized that it's an emergency. Because, you know, for example, when I teach about spontaneous internal bleeding, you know, it's one of those things that I'm not saying you can stop it, and I'm not saying that you can, you know, that you can do more than what you can do, but what you can do is recognize. And sometimes people will say, oh my gosh, I didn't realize, I didn't think it was that bad, you know, and they're almost wondering, how do I know it's that bad? Well, their gums are pale, their pulse rate's really high or really low, their temperature is, you know, through the roof or really cold, their respiratory, you know, their belly, their abdomen is moving to help them to breathe, and, you know, they've had a cough, or so it's that failure of recognition, I think, that somebody thinks, oh, they're just old, they've just had a long day, they're just tired, instead of taking that bit of time to actually think, but are you? I'm now going to do a little clinical exam and I'm going to see. So I think that for me is the thing. And then what that then does is blow people's minds, because they come in and I'm like, I'm really sorry, we need to rush your pet to surgery. And they're looking at me like, sorry, what? I thought I was just going to come in and get like a bit of pain relief. So I think because it makes my life hard then as well, because obviously they are completely confused about what I'm telling them. So I think that's probably what the mistake is. And it's not really a mistake, I suppose. A lot of dog and cat owners think, oh, well, I've got a vet there, I don't need to know this information. And it's sad. So again, a question about anti-inflammatories. No, antihistamines. So Piriton, they're all, you know, there isn't, people say, don't use Pirites, you know, all these antihistamines, you know, that's chloramphetamine, cetirizine, they're both the actual drug names, are used in both dogs and cats. You cannot use it if the animal is epileptic, okay, it's what we call contraindicated. Do you use it for swelling? It's a really difficult one, right? And I'm not being awkward here. The reason it's difficult is because sometimes it can slow down what the vet does their end if more intervention needs to be done. Sometimes if you see an instant reaction, often that means that the reaction is going to be quite profound and that they need more than just antihistamine. So therefore the oral antihistamine, by the time it starts working, you're going to be at the vet anyway. So was there any point? Having said that, I would say it's worth having it, because it's one of those things where often we can just help you, guide you, whether it's worth giving it, you know, based on what's happened. And equally, some people will carry it on a walk if an animal is bitten by an adder. And I always say, just call your vet first, tell them the situation and explain that you've got antihistamine with you, what brand or what drug it is, and then you can be guided from there on in. So yes, I do. I think it's worth having it somewhere, but not using it in epileptic animals. Oh, Tracy, you are my absolute like angel. So Tracy's already looked up Mish's wax. Tracy's just amazing. She's helped me on lots of webinars before as well. And it's safe for both domestic and exotic animals, including dogs, cats, horses, and chickens. So there you go, Kirsten. It is, so you can. Anya, I use the screw top blue packs as shown in your slides for both heat and cold packs. Yeah, that's fine. That's absolutely great. Often find warm tap water as hot as you can hold your hand to check. Hold the pack to your cheek is perfect. For cold, I can push in some ice cubes into cold water from the tap. They're very cheap and I carry them around in my kit. Ideal. And you can reuse and reuse and reuse. As long as you've got access to hot and cold things. I think the instant ice packs and cold packs are more for the fact that if you've got a dog walking van and you're literally like, I can't get actually a tap, but other than that, I think if you're reusing them at home, great idea. Oh, thank you, Sarah. I find it very informative. Last year, her cat had an anal gland abscess rupture. Oh man, I always think I just couldn't even imagine. Like I just the pain. If it happens again, what would be really good to help clean and heal quicker? Oh, I'm going to go over those bits next. So I'm going to go over some wound-based stuff next. Mandy, is my essentials kit coming back into stock soon, or do you sell the small empty kit as well as the large one? I can do the bags separate. What I need to do, I'm waiting for my bags to come to me. It's been a bit of a nightmare, so I'm not sure when that one will come in. But certainly you can have an empty bag and put the bits in that you want as well. Oh, Mandy, I know who you are. It just dawned on me. You can't see the small Lucillin antiseptic spray on the shop that your dog chewed the other day. Yeah, I know all about your dog. By the way, Mandy and I are very confident now that Lucillin is okay if ingested after our conversation. Yes, message me and I'll help you actually with that, because I thought that the other day, so I can help you. So send me a little message and I'll help you with your sorting out your kit. For a dog with lumps and bumps, how can you tell the difference between a tick's head to a bump? I should have done, I'll show you actually. If you go back to the slide, whoop, you can usually see mouth parts and legs. So if you slightly raise the bump, if it's an actual bump, you'll see nothing. It will be smoothly attached to the skin. If it's a tick, you'll see little black bits sticking out. And that's how you can tend to see, because people often get confused between skin tags, ticks, nipples. I've had that before when someone's desperately trying to pull one of their dog's nipples off. And I'm like, it's a nipple, leave it alone. And so usually you see definitely, and sometimes when you slightly raise its body, you actually see the legs moving. So slightly lift it from the skin, but not too hard, and you will instantly see. Okay, I think that was that set of questions. Let me just make sure. Yes. Karen's written ice cubes question mark. I don't know what that means. Was that an answer to something else that I had said? Maybe. I don't know. Oh, I'll come back to that in a second. So a couple of extra things. I'm going to go over some bandage material, some wound-based stuff, and some extra bits and bobs that you might find useful, and some creams and solutions and things. So I always think a pill giver is really useful. Pilling animals is horrible. And it's stressful for all of us. First of all, find out from your vet, does the medication come within a different form? Because we do have liquid versions now. They can be pricier. I'm not going to lie, they can cost more. But you know that a lot of the time, if you can get a prescription and then get it online, it might be that actually you can still get it in a cost-effective way. And there's other, some drugs, like drugs for thyroid issues in cats, we now have a liquid that we just rub on to the cat's ear, and that's it. And that's the way, rather than giving them a tablet. So there are other things out there, and we can look into it. If you're literally like, I can't get those tablets in, this is not happening. Obviously, there's many a product where, unfortunately, there isn't an alternative, but it is worth just asking. The pill giver is useful. But it's also really hard as well to use. But I do think sometimes it's worth having it if you're only having to do the occasional thing. I think dogs and cats can get wise to it over a period of time. And literally, you do just pull back the plunger, load the pill into the end, and then shoot it straight into the pet's mouth. And what I find is very useful is having a syringe of water ready, so you can just squeeze a little bit in, and they then tend to swallow. If you want to get them to swallow, then often just rubbing the throat. And also a gentle, just little blow through their nostrils tends to make them swallow as well. Obviously, make sure you're safe and don't get bitten in the face. And yeah, I think that's the best you can do. I mean, sometimes I'll say to people, if you can crush a tablet, great, especially cats, because if you can crush it and put it in something like liver paste, which tends to go down really well, you can put it on their paw. Cats don't particularly like that, like to clean themselves, and then they ingest it. Making a game out of tablets, licky mats, snuffle mats, those kinds of things can really help as well. Trying to make it not all about the medication and incorporate it into a bit more of a fun thing. But sometimes, you've got to get it in. It's got to happen. This tablet's got to go in. And so your pill giver might be your sort of safest option. So it's always worth, for a couple of quid, potentially having one around. So chamomile tea I mentioned slightly earlier when I was talking about sore eyes. We cannot use it in cats. They're very, very sensitive to chamomile. What I tend to use the tea for are a few things. So obviously I put there how to use it. Chuck your tea bag in, let it pour in your boiling water. I make it quite concentrated. Brew it with a saucer on top. Let it kind of really infuse for a good 20 minutes or so. Then when it's cool, you can start to use it. So obviously into a sore eye, you could use it for a sore eye in a cat because they're not going to really ingest it. You know, if you really feel loads of it's going to go, you know, seeping down their face and they're going to start drinking loads of it, then potentially not. But you certainly could wipe around and pour a little bit into the eye to help. I use it orally for dogs for tummy upsets. We usually say, as I put them out there, 1 ml per kilo once or twice a day. So if a 20-kilo dog would have 20 mils of chamomile tea, you know, on a day that it has an upset tummy. For some dogs, it can be really effective and really help calm the stomach down. As I said, you can have too much of a good thing, so you wouldn't want to keep doing loads of it all of the time. The other thing that I use chamomile tea for is anxiety. So I tend to make a chamomile tea and porridge oat bedtime meal for an anxious dog. Works quite nicely. So again, 20 kilos, so 20 mils of chamomile tea. You can, you know, top it up with a bit of extra water if you want to and water it down. And then I throw in a handful of porridge oats and feed that to the dog. And if they're old, add a few blueberries in for a few antioxidants and maybe a goji berry or two, and that will be a lovely little bedtime snack. These are very good to have, pre and probiotics. I've put a few brands on there. It doesn't matter. Certainly Procolin and Canacure you can use in both dogs and cats. They are worth having around. They really do help with cases of diarrhea. Obviously, again, they're mainly for sort of mild cases. If you've got a dog that's absolutely passing, you know, bloody diarrhea like there's no tomorrow, then it's going to need more than this. But initially, you know, if you've got a dog or a cat with a bit of smelly, sort of horrible diarrhea, but they're pretty well in themselves, they're still eating, drinking, behaving as normal, then I would get them started on this ASAP. You don't want to be waiting, you know, get going. That's why it's quite nice to have one in your cupboard. You can usually pick them up from a pet shop as well. They have all sorts of brands, but they all pretty much work the same way. Or you can ring up your vet and ask to pick up a tube. And we usually use them for 2 or 3 days. Of prebiotic, probiotic, kaolin. Kaolin slows down the gut movement, so that's why it sort of helps it to work. And as I put on there, remember your bland diet, not chicken and rice. I don't go for rice, I don't go for chicken. I'll tend to reach for sweet potato, pumpkin, butternut squash, something fibrous like that. And then for dogs, I'll mix that with either scrambled egg or banana. They'll eat bananas. For cats, I may be sort of down the line of white fish with a bit of, say, sweet potato or something. But you know yourself if they have an allergy to anything that we need to avoid that. But fibre is a good source of really helping the gut. And small meals frequently tends to help diarrhea as well. And so usually if you're on with this and your bland diet, most dogs and cats will get over it very quickly. Of course, you might get hairballs in cats. These are definitely a couple of other things that I would say if you've got a regular hairballer, whether that's even a term, then it's thinking about why, because sometimes, you know, if they're very, very stressed cats, they will overgroom, and unfortunately that then leads to hairballs. So we might have to treat the underlying symptom. They might be over grooming because they're painful. You know, they're licking an area because it hurts. So it's about working out why are you over grooming. You know, I put a couple of items there that, you know, I've got one here actually. So I've got Pet Remedy here. It's often quite a nice, good valerian-based spray. They say cats actually tend to do really well with pheromones, maybe better than dogs. So with dogs, we usually go for Adaptil, and some people find Adaptil really useful, but that's a pheromone. But cats, they tend to say Feliway, especially you can get collars as well that they wear all the time, seems to be a bit more effective in them. But, you know, I think you have to find what works for your cat, because sometimes it's not enough and you need stronger things. And I tend to now, I find I get a lot of elderly arthritic cats. They're a bit sort of anxious, and I'm not surprised because they're painful. And I stick them on gabapentin, and they're like, owners are like, wow, my cat's so lovely. Yes, because gabapentin's a pain relief and an anti-anxiety. So your cat probably feels great. You know, we've taken away his some of his arthritic pain. We have to give in other things as well. And we've made him feel really stress-free. So he's feeling brilliant. And then obviously there's other things. NutriCalm, Calm Cat is another spray that you can get. Amitriptyline is a drug. We try obviously to work out why they're over grooming and not just medicate them with sort of behavioral modifying drugs, because they might not even need that. And then if we do think they're overlooking, do they have a flea allergy? As I say, it only takes one tick bite and they can bite their area. Are they allergic to something in the house? You know, have you managed the house for things like dust mites? So that's another thing I didn't put in here as a first aid item. Any itchy animal needs you to be spraying your house with something like Indirex, RIP, Acclaim, one of the strong flea treatments. Yes, they do smell chemically. They cannot be used if you've got birds and reptiles in a space. But what they do is they don't just tackle environmental fleas, they kill dust mite, and they kill dust mite for 12 months. And that's so important for an itchy animal. They can need not to come into contact with dust mites. It's another thing you can use. And then if you suspect a hairball, we do have Catalax, and that will really help with them passing that hairball. So you've got that you can use if you really feel they're kind of coughing and, like, you know, trying to be sick, or, you know, and it's going on a bit and they're prone to them, especially if they're long haired. And then psyllium husk, you can use that in dogs and cats actually with diarrhea as well. It's a high fiber supplement. So basically it helps with getting the moisture in the intestine just right. So we use it for both constipation and diarrhea. So it's quite useful, but often it gets the guts sort of moving with hairballs. So sometimes people will use a mixture of both, or they'll just use perhaps just the Catalax. So the other thing is bandages. So I'd say always have one of these stretchy conforming bandages. That, again, those of you that have been on courses with me would have used these when we've done any bandaging. And again, in first aid kits that I provide, I tend to provide 2 different sizes of the bandage. You know, you don't need a million of them. You know, and sometimes you open up a first aid kit and you're like, great, it's just all bandages. And bandages can be great and so bad all at the same time. Bandages, we need to think about, do we need to put you on? When we put you on, we now kind of stop airflow, and, you know, are we going to delay healing? Now, bandages can be amazing. You know, I use some really specialized bandages that work absolutely beautifully on really nasty wounds. But if you can perhaps stop the animal licking the area another way, or, you know, I had a dog the other day, had part of its quick exposed from a nail injury, and, you know, it couldn't be examined because it's really it's an unexaminable dog. Okay, so there's kind of almost no point to our consult. I can't actually even touch it. Nobody can anywhere. So it's really impossible. But of course, because I can only prescribe when the dog is under my care, I have to actually have them in the room and prove that I've had them in my room. So they have to at least come in. So basically, you know, she's saying to me, shall I apply a bandage to it? I think he'll let me put something over it. And I was like, just dunk it in cold black tea. Just literally do that. Because quite frankly, once you start bandaging it, you often start causing sores elsewhere. I can't get the first bandage on to show you how tight it should be. And if you make it too tight, you're going to cause a lot of swelling. And actually, they can be a real nightmare. They're great for first line, I need to cover a wound, a bit like this first picture shows. If you were leaving a bandage on, you would never leave the toes out like that. If you were leaving it on overnight, you've got to apply it with the toes included, unless you are a brilliant bandager. Because, you know, I mean, I mainly apply bandages now when I've placed an IV line and I have to bandage it in. And I do leave pets' feet out now, but that's because I've been doing it 15 years and I can gauge exactly the tension, because otherwise, not always, sometimes I'll go into a kennel and be like, oh my gosh, we need to redo this bandage. These toes look really swollen. It's very easy to get it wrong. And unfortunately then causes extra pain because they get lots of swelling in their foot. So usually leaving it on overnight, you're going to have to incorporate the entire foot. But these kind of stretchy bandages, easy. They can go directly onto a wound. I'd usually say try and put something else underneath it. But, you know, if that's all you got, just stick it on round and don't worry too much. You know, and it might be that you put it on quite firmly to stem a bleed. I would say usually we get 2 fingers in between the bandage and the skin. For these, when we're stemming a bleed, I'm not too fussed about whether it's tighter than that. You're only doing it for short periods, so you know that's okay. We can use them to do a makeshift muzzle, like that image shows, literally tying it around the nose if we've got nothing else. But I've put remove ASAP. Remember, dogs need to pant to cool themselves down. We cannot restrict their airway like that. We cannot leave it and travel all the way 20 minutes in a car with a dog with its muzzle shut like that. It would just be not only detrimental to welfare, dangerous to their health. So really, we're using these conforming bandages mainly to cover a wound, stop them licking it. If it's short term, say just apply. If it's a long term, must include the toes. I know this isn't a conforming bandage in the image showing a tourniquet, but I'm just trying to show you an image of a tourniquet. This has been used with some sort of drip tubing or something. And the idea is if you've got a bleed on a limb, you tie something tight at the top of the limb to stop blood flow for severe bleeding only. This is when you've tried applying a bandage with some pressure, you've put an ice pack on top and it's just bleeding through, bleeding through, bleeding through. You're putting another bandage on, it's got a pulse to it and it's just pumping at you. Then you're going to use a tourniquet, but only then, okay? Because we're going to cut blood supply to the leg. That can cause other reactions within the body. So we have to be careful. And then we need to get immediate help if we do have one of those on. Cohesive bandages. Now, my tip for those, I've got one here. I put on there and I thought I'd just show you. Oh, by the way, again, another little plug for myself. But on YouTube, I've got this page called Sophie's Vet School. It started out during COVID where I wrote courses for children and did them. Obviously, it's all free content. And then I just started adding bits. And I'm always adding the odd video now and again, like how to deal with your dog's willy if it's stuck out and all sorts of things. In fact, I went on it earlier. I was like, God, I sound really deranged. I'm literally there like talking about dog's willies on one. And then I'm like, let's talk about your dog's balls. And I'm like, oh my gosh, everyone must think I'm just, I'm a weirdo. I was like, so basically I got lots of little extra tips on there. And I have got a bandage video on there and it's a nicely edited, it's not me waffling, it's showing you stage by stage how to use the banding materials, how to bandage a leg, how to bandage an ear. There is how to bandage a tail. I'll show you something else for that in a second. How to bandage an abdomen. There's lots of things. And I do talk to you about vet wrap. I'm not sure in there if I tell you that what I do now, and I get all the vet students and I get all the nurse students when they're new to bandaging to do this. It's really laborious. I'm there like, right, I need you to unravel that bandage off the roll. And they get to the end, they're like, now quickly put it back on the roll. Take you 2 seconds. Like, it doesn't have to be looking pretty. It doesn't matter, although this vet wrap's very pretty, I think. I like a bit of leopard print. And then basically now when you apply this to their foot, it will come off like a normal bandage and you won't be pulling each time and adding tension. I feel like that bandage in that image there looks really tight to me. Like it looks like it's going to be, in fact, I swear in the image, even its toes look a bit fat at the end because vet wrap gets very tight. So if you're not experienced with using it, ravel it off first. And now you can just feed it and feed it and feed it and you won't cause an issue. Otherwise, if you're not experienced with this, trust me, I've seen some pretty grim things where blood supply starts to get restricted and we sort of take it off. And there was a case of a tail being bandaged, take the bandage off and the tail comes off with it, it can be grim. And so just be careful with it. And as I said, I would not use it on an ear, nowhere around this area of the throat. The only time we use it around the neck is if I am doing work for the Pet Blood Bank and we've taken blood, a donation of blood. They obviously have a big needle in the jugular and that's how we obviously get the blood. By the way, if you've never taken your dog to go and give blood, oh my gosh, they love it really, because they're just fed. They lie there being tickled and fed. They don't even know that any of this is going on, but we put a bandage on after and we do put some vet wrap around that. But again, that's why I get people to unravel it so it's not tight, because we can't have it tight. And if we, it's ideally we are putting it on top of the previous bandage, the conforming bandage, because when you feel it, it does feel quite soft, but it's also got quite an abrasive texture. And you'll find that when there's movement, it will just rub, 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 just gently all the time. It's just moving ever so slightly. And the number that I see with bandage sores and they can develop really quickly. So we usually finish the previous bandage higher than this one. So the white bandage goes on, this goes on and finishes just below the white, and then I add a layer of tape around that to hold it all together so that I haven't got this touching the skin at any stage. If this is all you've got and you've got a bleeding dog leg, just wrap it on round, doesn't matter. This is more if we're keeping it on overnight. I don't want you to make the animal's legs sore. Oh, yes, sorry, I nearly forgot that little bit there. Right, so this is mainly going to be your dogs now. And again, anyone that's been on a course with me would have learned about hemangiosarcoma, which is a type of tumor, and it can grow on the spleen and it can rupture. And when we get a rupture and it's spontaneous, we get a massive internal bleed, and teach you all the signs of how to look out for it. And or it might be that an animal has been hit by a car and maybe then their belly's getting really big and you're like, oh my gosh, I think you're bleeding internally. Sometimes you can't always tell. But what I say is, if what we do in clinic, and what I would say to an owner if it was something I would suspect was happening, is that we take a bandage, and it can be just straight round with the vet wrap because this is more of an emergency, and we wrap it from sort of the middle of their spine towards their back legs and create an abdominal bandage. And the idea of that is we put it on with a bit of pressure, so more than just getting 2 fingers in between the bandage and the skin. We apply more firmness than that. As long as the dog can breathe comfortably and you feel like you're still taking normal breaths. And basically it can slow an abdominal bleed down and buy you time. So, it's not everybody has an out of hours vet that's close by. And some people have got to go quite some distance to get help. And so, it's things like that I'll say to somebody, I want you to place that. You've got an hour's drive or something, and that does happen. I need you to do that because I need you to buy some time, and that's basically going to slow that bleed down. Other bandage material I've got on here, so I just saw this picture today, it just made me laugh. I do like a good old pool noodle for a dog's tail. I'm not quite sure this is like the best image, but it did make me laugh. But a pool noodle, you can just cut down the middle, wrap it around the dog's tail, and then either secure it with a bandage on top and then a bit of vet wrap. You can use tape, more heavy duty tape, but obviously when it is removed, you're going to have to soak that tape so the stickiness is gone, because heavier duty tape's really going to stick hard and you don't want to hurt the dog. But pool noodles are really your best option for a tail. Of course, you can cut them as big or as small as you like. So if it's just at the end where the tail is bleeding, then obviously make it fairly good size, and then start maybe your vet wrap. Well, do your coat conforming first, and then put your vet wrap over the top and a bit of tape at the top of that, and then that will usually hold it in place. And then I put Compeed blister plasters. These are good for bleeding ears. So if you've got an ear tip injury, so it's going to mainly be your kind of less hairy dogs and cats and rabbits. And matter, which animal we're talking about. Of any of these bandages, a lot of the things can be applied to multiple animals. So Compeed blister plasters, you peel them off, you stick one side of the ear, one the other side of the ear, slightly overlap them so that they can then seal together with the ear tip sort of within it. And that can work really nicely so that you're not there trying to put on an ear bandage. You're like literally want a quick fix. It's needed to sort something out. Then that can be very useful. I put these always in all my first aid kits, Primapour. So they are like a doggy plaster or a cat plaster. But they're kind of designed, they stick better, obviously, than a normal plaster. You have to always be realistic that on a very hairy area, it's always going to struggle, but certainly on areas on their belly. And I've had it before where, owners have had things like this in a kit or similar to, and they've said, oh, the stitches are coming undone from an operation or something. And things like Primapour are ideal. You just stick it straight over the top, off you go. Or you get a wound on that area, you just stick it straight over the top and off you go. And you haven't got to be there working out how to cover it or bandage it or finding an old baby grow or whatever it is to try and cover the animal. And then obviously all the other things are kind of self-explanatory, like We need some scissors. We want to make sure they're not really, really sharp. So I tend to, again, add blunt-ended scissors so that if the dog or cat moved, you're not going to cut them, especially rabbit. They've got skin like paper. I tend to reach for a Micropore or a Durapore tape, but you can pretty much use most medical tapes, like the Elastoplast tape as well. It's just that that's really, really sticks hard, which is useful, but you're going to have to absolutely soak it before you remove it. Otherwise, it really, really hurts. Soft ban is another type of bandage material that is like cotton wool. So if we're leaving a bandage on long term, we go for soft ban, and we go for conforming, and then we go for cohesive. So we have these 3 layers. But again, I put soft band question mark. Depends if you feel bandaging is going to be something that you need to be doing, or perhaps, you know, you think, yeah, my dog has just had this injury and I've been advised it needs a bandage done every 2 days, then you will need to start with soft band and then move up each layer. Cotton wool, I don't like it stuck on wounds. It's very good for cleaning, but dry cotton wool placed up against a wound, you'll get all the little fibers in there. If it's all you've got, it's all you've got. But I prefer you to wet it first before you put it on so it doesn't really stick, or use something else. But cotton wool for bandages is useful because if we're leaving it on overnight, we put a small, tiny piece of cotton wool in between each of the animal's toes, and it stops them rubbing because they get a bit sweaty when they're in a bandage. So just a tiny little blob in between each of those toes. And then swabs, foam dressings, both very useful. Foam dressings are like that. They're like a piece of foam. Also, light on this is terrible, but you probably can't even see that. But they are, they're thick, they're spongy. So again, if you had a cut pad, you might think, yeah, I'm going to stick that underneath, because when the dog walks on it, there's a cushioning there. So that's the sort of thing you would use on an area where maybe they're weight bearing. I mean, you can put it on any area, but that would be one of your most obvious, because it will really pad it out when the dog or the cat's weight bearing. And then how do we clean things? What do we put on things? And then we're sort of nearly at the last few bits. Now, this slide might make you go, what? And I do rant and rave about this, and I'm sorry, but Hibiscrub, this is the advice off the back of the pack. This isn't me coming up with it. So they say not to use to aid healing. In fact, they say can delay healing. So if we're using Hibiscrub, we need to use it appropriately. So I don't use it on wounds. Not to be used on open wounds. I say all you got to do is go off and read the back of the packet. When they say must be diluted, otherwise can cause irritation. So there's this argument that maybe on open wounds, it could be used. But if it was, it has to be diluted at a 1 to 50 rate. 1 part Hibiscrub, 50 parts water. I mean, that's heavily diluted. And I think most people will put a blob in a pot and just pour a bit of water and off they go. And actually that can be really, really irritant. It can actually become an irritant. And again, as they say on the back of their pack, intended for sterilization, not healing. That's what Hibiscrub is made for. It kills everything on the skin, even the good stuff. But that's okay, because we're about to go and do surgery and we need the animal not to really have anything going on. So we've got to use something highly disinfecting. Ideal for pre-op cleaning, yes, it is. We still use it now. We don't scrub our own hands as vets with it anymore, because my word, after a day of surgery, your hands are so sore when you scrub with Hibiscrub all day. And then again, must not be used on angry wounds. So you could get away on some wounds. It has to be severely diluted, but you've got better stuff. For me, it's just not for me. So I'll tend to reach for probably one of these things here. If I'm at home, it depends what I've got. So Lucillin, I usually have that bottle in front of me. I didn't put that bottle in front of me either, but you can see the picture of it on there. Lucillin, again, I put that in my big kit. I always put a bottle in with that, and that can be used on, you know, pretty much every animal, and it's non-irritating. Some people say, oh, it can be used in the eyes. I sprayed it in my eye. Don't use it in your pet's eye. It's not good. If ever you think something can be used in an animal's eye that someone's told you, if it's obviously safe for your eyes, try it first. I always try these things first. So Lucillin's very useful for wound care and cleaning. So there was a question about sort of abscesses on a cat's foot. And I would say that, you know, I would go for something like Lucillin. You can go for colloidal silver. I've got that here actually, active silver. Some people love a bit of silver water. You know, this is going to be a pricier option because it's a bit more expensive to buy a bottle of silver than it is for Lucillin or Vetericyn. I do like Vetericyn a lot as well, and they do make some lovely products. They're pretty similar, Lucillin and Vetericyn. But I think it's cost comparison, and also Vetericyn do a Vetericyn Plus, and Vetericyn Plus has hydrogel in it. And what that does is add moisture to a healing wound to help get rid of dead cells, dead skin cells. So you might be more drawn to that if it's a bit more open. But I think they both got their place for sure, Lucillin and Vetericyn. And then, you know, good old saline pods. They are great. I always say, you know, I've got them in front of me here, but I always say you have a few in your first aid kit. They can go in eyes, they can clean a wound, they can, you know, they're just easy. And then I've got to go back to the good old tea. That's what my dogs get in this house. I'm like, yeah, well, actually, not true, because I do obviously sell first aid kits, so I often have something else in. But something, if I'm away and I haven't taken anything with me, then yeah, it's what I'll bathe with. And usually you've got tannins and bioflavonoids, especially in things like black tea. It doesn't have to be, it can be breakfast tea, but kept black and don't put any milk in. That can really help anti-itching and anti-inflammatory, which is why I put it in eyes, because it usually feels quite soothing. Again, try it in your eye, and you know, it might be a game changer for you. And then in terms of applying things, of course, you know, you're under a certain obligation if it's not your pet. But some of the items on here I find really useful. So Arnica cream, this is the brand, again, that I put in first aid kits because it's safe. There are one or two brands that are a bit questionable. So I go with this one because this is the one that we use in all the vet clinics. And again, it can be used for grazes, clipper irritation, and it's specifically for unbroken skin. Filter back is good for all animals except cats. For cats, it has to be used under veterinary guidance because some can react, so it has to be decided as to whether it's appropriate or not. So I just find it's much easier to just tell cat owners to use Filter Clear, which is their sort of sister equivalent that is safe for cats. It does act like a second skin. It almost sort of sticks in place, which is very useful. And again, antibacterial. It's also a sunscreen, and it can be used on damaged skin. So it can be, and it's a nice antiseptic. So when people sort of say, what about Sudocrem? You know, this is where I would say invest in something as a general all-rounder like Filterback, or a general antiseptic cream that is actually made for the animal, because Sudocrem has quite a bit of zinc in, and it's not my favorite. I mean, if you're desperate, then fair enough, but I tend not to reach for it. I love a bit of hydrogel. Again, I put this in kits as well because it's quite good for wound protection. If you've suddenly got an open wound, what it will do is it will keep the tissue kind of wet. It will keep it healthy, whilst, you know, perhaps it might be that they're going to get stitches, or, you know, it's an open sort of barbed wire wound. I find that this is really good at sort of repelling bacteria and helping keep the tissue clean and safe. We also use it a lot when animals are healing from wounds as well. You might have heard of a brand called Intrasite, which is very similar. This is another hydrogel, and you just use it to help wounds to heal. And again, it can be used on burns. So this, for example, here, this big old sachet here is a burn gel dressing. And all it is a dressing that's impregnated with hydrogel. And it's here, it's used, this is one made for people. I don't know if you can even see that on there, because to me it looks like, look at this camera, there you go, you can see if I hit it. So I'll use it again. I'm not saying this brand, but this is an example of a burn gel dressing. And basically that's a person one, but that could be held on to an animal as well, because it's just hydrogel based. And then on here, and again, I tend to use a different brand called Activon rather than the Anniewell Manuka honey cream, but it doesn't matter. It doesn't matter. There's a Cruce, is another brand. It really doesn't matter. So Manuka honey, it's medicated Manuka honey cream rather than just Manuka honey, and it's more spreadable out of here really than just taking it out of a jar. I love it. It's a great antiseptic. Obviously, wounds are going to usually need to have veterinary treatment, especially if they're puncture wounds, bite wounds. I mean, they can be seriously nasty. But sometimes, you know, it's a case of a hot spot where the animal's irritated a bit of skin and made it quite red and sore. And a lot of these products will just knock that on the head. So again, things like Manuka honey can be really nice, or a bit of filter back. You know, they're very useful. Hydrogel, and maybe a bit more of an emergency situation where you got an open wound, you want to slap something on it to kind of, you know, maybe even under the bandage, to keep the area sort of lubricated whilst you go and get help. So all of those things are some items or safe things that you can use. And then spray on plaster. Another thing that I often have in my shop as well, and I again, it's good for kind of almost like an emergency situation. Obviously, if the wound is already dirty, it's a bit more tricky because you might then spray and keep the sort of dirt in. But certainly if you've got a barbed wire wound, it might be that it's pretty clean already. You know, you're like, it's just a straight slit. Perhaps that, you know, been out with the dog and it's basically a straight slit. In that case, something like this would be ideal to spray on it, because what it will now do is it will repel any more dirt, water, germs, basically, to help while you then go and get treatment for it. So that can be useful. And the other time I quite like things like this is, you know, if a dog's had surgery and they are able to go out for even just sort of a short 10-minute lead walk, you know, look at the rain the other day. You know, if they're walking even on the pavement, they're going to kick up mud and dirt. And if they've had surgery on their belly, I always quite like a layer of this to protect it. I mean, you could put a Primapore plaster over it to protect it from dirt. But often, you know, if it is wet outside, that might not stick very well. So this I find works a bit better. And I just put on there, yeah, horses, people sometimes use this for things like mud fever, trying to help with, you know, reducing reaction to mud. And again, safe if ingested. And then aloe vera, people ask me about this. Absolutely. You know, when I look at bee and wasp stings, I always say to people, perhaps apply arnica cream after you've done your kind of your lemon juice or your bicarb or your ice pack. But you can put something on after as well to continue soothing it. And that could be arnica, that could be aloe vera, that could be filter back. You know, you've got various options here. So it's quite nice to have a little thing that perhaps that you've got a thing for. You might be there thinking, oh, I love aloe vera. Well, in that case, make sure you get a nice pet friendly one, and you could use that. You know, that's another option for you to use on them. And then this bit on rabbits for things that we might use on them. And don't get me wrong, lucillin, filter back, you know, they can all be used on our small pets. But as an extra, because they're prone to things like, fly strike, where flies lay their eggs if they've got a bit of a dirty bum. And then unfortunately, the eggs form maggots and they burrow through the dogs. Well, it happens to dogs actually as well. I've seen a few dogs with fly strike, but burrow through the skin. And it's terrible, it's horrible. And you know, many of these rabbits end up having to be put to sleep. So as a rabbit owner, I tend to say to people, you know, especially when we're at that stage where we are in the warmer weather, then use Rearguard. And it is a product that we tend to say use every 10 weeks. It's a liquid, you wear gloves, you rub it all over the back end of your pet. And then the other one on there that we use for a variety of animals, not just rabbits, but I think it's with the F10 range, do a lot for like reptiles and things as well, that are nice first aid items. We'll use that if we have sort of noticed that there may be some eggs, or we perhaps don't have Rearguard, we spray with that, and as it's put on there, it does repel maggots. And if there are maggots evident, they kind of come crawling out. It's disgusting when you spray the F10 on. I put not cats. This is really highly toxic to cats. So again, if you keep rabbits, you've got cats, it might be that you think, yeah, I don't think I'll go for the wound spray with the insecticide for rabbits, even if they have got a wound, because I'm worried about the cat. But that's a really good insecticide. But as I say, maybe not if you've got cats. And then I think this is one of the final slides, blood stopping as well. So you've got options. So a nail, you've got your silver nitrate pen, which usually come in a little bag. And I'll just show you what the tip look. Well, you can see the tip on there actually. Let's hit that camera again because it keeps take the top off. It's got a tip like this. You gently rub it against the quick. I mean, you can wipe it off after if you want with a baby wipe in between sort of uses, but it's a gentle rub. It's not a digging in, it's gentle. And we use that on the quick to stop bleeding. I just find it very handy and useful because it's small and it's easy. But some people prefer a powder like Trim-X. I'd say this is definitely easier for cats for sure, and rabbits and things with the sort of fine nails. I think it's easier, whereas I think the powder almost gets quite difficult to put on. Obviously then in your first aid kit you might want some cotton buds, because sometimes loading those, making them a bit damp, loading those with powder and just rubbing those on gently is easier than trying to kind of put the nail in the powder. And then if all else fails and you're like, I can't stop this nail from bleeding, I wet the top of a bar of soap and push the nail in that, and it will form a plug at the end. And, you know, sometimes that's all it needs. But if it does need more, it gives you time to calm down. Remember, a lot of bleeding is based around sort of a higher blood pressure or adrenaline rush, or, you know, and if you are perhaps cutting a dog's nails or a cat's nails and you do catch a nail and it does start to bleed, then often your blood pressure goes up because you feel terrible. You know, you didn't want to hurt them. And then their yelp or show a bit of pain. And between the pair of you, you create this really like, oh, situation. And your blood pressure goes up, theirs goes up, and the blood just keeps flowing. So those are sort of the ones I'd say for nails. And sometimes the soap would just give the animal a chance to calm down and you to calm down. That's an example there of an actual tourniquet, which I didn't put in front of me, but literally you put it over and you can see the clip just pushes upwards and you clip it into place. So if you don't want to use a bandage and you want an actual tourniquet, you can. And I would say maybe for the very, very, very active, crazy dogs, that may be something that you have in your first aid kit. And I think most people, when they're out walking and things like that, just even taking it, one of those stretchy conforming bandages and chucking that in your pocket, so handy. Stick it on a wound, use it as a tourniquet. You know, it's just got a couple of uses, and it's so lightweight. You put it in your dog walking coat, or, you know, whatever you take with you. And then Bloodstock by Aqueous, so that's this stuff. I used to use a product called Clot It, and it's discontinued. So if anyone has bought stuff off me before and goes, hang on a minute, I used to have Clot It, they don't make it anymore. So I went through absolutely loads of trials of different things. Obviously I didn't make things bleed and then use them, and not trials like that, but before I had an opportunity to use it, or I asked people about them, or, you know, had a look at the different products, and I found this one, you know, the next, you know, sort of next useful thing to help with the skin bleeds. So I wouldn't find it useful on nails, but bleeding wounds I would. And again, I've just put down on there some other things you can do for bleeding. Cobwebs full of vitamin K help form a clot, can go on a bleeding area. A wet tea bag, as long as it's got caffeine in it. Caffeine will cause vasoconstriction, which basically sort of shrinks the blood vessels, therefore making the bleed less. Cold pack on top of the bandage, as we mentioned, causes vasoconstriction, bleeds less. Pressure bandage, so we always know that it's 10 minutes pressure to help form a clot. So you don't want to keep dabbing. So often, you know, get one of your conforming bandages, just wrap it round, leave it 10-15 minutes. As long as it's not pouring through the bandage, have a look afterwards. You know, just see if you think it was just a small tiny like nick, but it won't stop bleeding, just give it 10 minutes to stop, then have a little look at what's happened. And then if you get any, sometimes you do get wounds right under the armpit that bleed, often in really active dogs, again, get caught on barbed wire, preventing, and you've got quite a big artery running down there. If that was to happen, you were to catch that artery, or of course, even the femoral artery running down the inner thigh, in the back leg, you're going to need a tennis ball to stop those areas bleeding. So you're going to need to get right in there, push it in hard, to form, to apply pressure. Be hard to do anything else. Obviously, you're going to have to move them to get into a car, but somebody really needs to be putting that pressure on the whole time with their body weight, to try and basically stop them from profusely bleeding. So I do have a shop. I've mentioned that a couple of times. You can use it for ideas. You can go through and say, what's she put on there now then? Because often I introduce a new thing. In fact, probably be my winter task will be going through more products. And I'm planning to add a few extra things actually. I'm quite keen to add a few ranges of stuff, because I think all under one roof for me is easier, because I can sort of say, look, have a read about this, not necessarily even for you to buy. Sometimes you just want to go and see, what have I added? Why have I said it might be useful? How could you use it? Don't have to buy it off me. You can use the information only. You know, I really don't mind. I'd like you just to get what you need and what works for you. I also do have a book coming this year. Oh my gosh, this book, not a biography or anything stupid like that. I'm not going to tell you all about my life. Don't worry. I mean a first aid book. And I've complicated it for myself. You know, those people that know me know I love to complicate, procrastinate, you know, any of the 8s just to make my life harder. I've made it interactive. So, you know, just when you go to finish it, and then I say to my partner, right, QR codes for everything, please. And he's like, sorry, what? I'm like, yep. So basically the way this book works is it's an A to Z. So you'll go to seizure, S, and it's quick. It's not me like going, a seizure might happen because of blah, blah, blah. Basically, it's like, I need you to do this. And then for most of the topics, there's a code you can scan with your phone. And if there's something practical, I've said to you in there, maybe put an image in, there's a video of me showing you. Again, very quick. So if I'm sort of saying, you know, stem this bleed, you'll just see me actually kind of get a bleeding limb and put something against it to sort of say, that's what I mean. You know, like when someone said earlier about bathing an eye, QR code it, I'm showing you bathing an eye, so that then you can be like, oh, that's what she means. So that will happen this year. It's just that I like to make my life harder. So hopefully that will be useful to you. And hopefully this has been useful to you. As you all know, you can ask me any questions any